methods of family planning are very dangerous to people, in the spirit and in the physical. And we wanted to tap knowledge of how it can be done naturally according to the way God has created a human being. And we wanted the whole church to get this knowledge. But it looks like we have scanty interest. Nonetheless, we are enough. For Jesus said only 2 or 3. And so we are grateful for the members who are able to come. Praise the Lord. We're testing the equipment. So, Sebo, you need to direct us. Is it going, you are going to just discuss. You better stand. Okay. So I hope the camera is in the good region. So Pastor Joseph, don't just be roaming around. You also find some work to do, like holding the camera when it's in this side. Praise the Lord. I think we are behind schedule. Time has gone. But I think we can have a brief interaction. We wanted to have it live for the sake of those who are not able to come. Perhaps by the grace of God, they will be mobilized. So maybe before I welcome Doctor to take over this microphone, I would like us to stand and we pray so that we are not going to do introductions. We are all called believers. Wash us with the blood of Jesus. Hallelujah. Wash us with the blood of Jesus. Wash us with the blood of Jesus. For it washes. Almighty God, here we are in your presence. Forgive us, for we are sure that we have not been following your requirements according to your standards. Wash every sin, every iniquity. We renounce every wickedness. We renounce every sin that detaches us from your presence, Lord. Forgive us, Jesus. King of glory, we are here in this session to share health activities. King of glory, give our doctor wisdom and give us understanding so that we shall have a productive interaction for the glory of your name. Demons that are not happy for this meeting, in the name of Jesus, be consumed by fire. Fear, in the name of Jesus, be consumed by fire. Thank you, Jesus. Thank you, Holy Spirit. Thank you, Lord. In Jesus' name we pray. We may get seated. And like I said, if you have a question, you can send direct to his WhatsApp number, or you can write it. Sometimes asking questions becomes very difficult. You want to ask a question, but the question is hard than exam. Yes. Let's have a productive engagement. Ask questions. Learn. And when you learn, teach others. No longer you are welcome. You come and sit here. You come and sit here. Do we need an interpretation? We might just be going Luzungu. Luzungu. Praise the Lord. Doctor, you are most welcome. God bless you.
Amen. Thank you. Praise Jesus. My name is Oluka Vincent. pure Itesot, from Ngora district, Mukura now. Actually, our village, I am sure most of you know Akubui. You always go for conferences there. When you cross the swamp, you go to Kokodu. That's where I come from. But I have many relatives in Akubui. When I was growing up, we used to hear about some religion in Akubui, CDC. I did not know about it much. I never went to their church, not even one day. But when I came to Kampala, my friend brought me to church here, Okiro Andrew. I'm sure most of you know him. So we prayed. After the prayer, I realized it is not a strange church. It's just a normal church, and a good church. Because there is also where we pray from the village there, and I even told Andrew that the teaching and the prayer is the same. I thought they were going to tell me like how you'd imagine how Muslims teach others. And the funny thing is that, again, I got many of my OBs in this church, so I felt at home. Very many of them. And right now, he was there when I started in Ngora High School with him, but I think he had left before I joined there. But they were these young ones. I also left there. They are part of this church. And so I felt I'm at home. I'm at home. So I always feel so good. Even when I went to the village one time, I told them, they asked me, where do you pray from? I told them I pray in CDC. They say, the church from Akubui. I was like, you probably don't know that church. That church is just the same as ours. Yes, the church from Akubui. For us, they will know it as a church from Akubui. So that's it. So I'm really very glad. Talking medical, talking health, sometimes it's challenging if you have people who believe in fear. I'm happy when Pastor was praying, was saying spirit of fear should go away. People who feel shy and feel ashamed. But for us in medical, I will always give you very many examples as I keep on teaching today. My biological mom left us long ago when I was in P7, but there is his elder sister. In Teso, we call her Ija. But in Buganda, I'm supposed to call her Mommy. Yes, so I grew up calling her Ija. So one time I was home, I was like, Ija. They told me you are suffering seriously. These people have sent you charms, and all your bones are boiling. She was like, who told you the story? I was like, I will not tell you the person told you, but just tell me, is it not true? My son have suffered. Every night I have to pray. They are sending me spirits, and all the bones are always on fire. I told her, just stop deceiving. Actually, nobody told me, but my medical knowledge tells me at your age, I expected this. But I know you can never tell me anything. You see him as your son, and you will always fear it. So I told her what to take. She refused to take it. One time, the condition worsened. She was taken to Soroti to Dr. Ogwang. I'm sure most of you hear about Dr. Ogwang, Soroti. And she was given the very drugs that I had given her that she refused to take. I had taken already drugs from Kampala. Now she picked them to start swallowing. And she called me, the drugs you told me, it is very true. Then another story. This one is a good one. It happened in Tororo. It happened around 2014, 2015. There was some hospital in Tororo where the doctor was very tough on nurses. But our African mothers, they believe in the Bible. Produce and fill the world. This man is a doctor, a very big doctor in some hospital. His mother is still producing. He's very tough on nurses. You know, when you do any mistake, you're very tough. So on a good day, I don't know whether it's a good day or a bad day. The mother, time for delivery reaches, his mother comes to deliver. But in the time when the day nurses are supposed to change to go home, and the night nurses are supposed to change clothes to start working, they said, his mother has come. So what we do, let's delay changing clothes. At that moment, you blame nobody. So he was calling the nurses. They were saying, we are changing. You cannot go. You have to respect ladies. You can't go to their room. What are you doing? He had to go and deliver his own mother. In a church, it may look like, I don't know, Pastor will guide me. That's why I want this thing to be very interactive. Pastor will be guiding me what the Bible talks about some things, but for us in the hospital, we believe the patients are for two people. The patient, number one, is for God. Number two is for government, not your patient. So even if you're treating your mother, you're treating God is the patient and for the government. Should you leave the patient to die, God is not there for you to answer that moment, but you'll answer to government. So this man had to go and deliver his own mother. I don't know what the church, but assuming you're a doctor, and remember you are there to do the job for two people, for God and for the government. And she's in a condition that if there was a friend, you would say, come and, because that's what we do in the hospital. In case your men say, come and take over. But at that moment, you are the doctor. Would you deliver your mother? That's very nice. So what I'm trying to say here is, first of all, I'm on other things, but not on family issues. And I have been, actually, I always tell Andrew, my friend who brought me here, many things that, Andrew, there are some things I feel like should be done in this world. Number one, if every church incorporated on top of preaching, they also talk of health. Because the people you're preaching to, they are hiding health problems that they may even say, of course, it may be demonic, because even fear alone is demonic. But some things can be solved by knowledge. I'm sure the Bible must be talking somewhere about my people are dying because of lack of knowledge. Then the other one time I was talking to Andrew, I was like, Andrew, by the way, I am two people in one. I'm also a secondary school teacher. I first did education because of, what happens in terms of poverty. Then when I got to my government job of education, I was like, let me go back and chase my dream of being a doctor. So as I talk right now, that's why I can stand here without fearing. I'm a teacher. I teach in Kampala High School. Then one time, pastor and my OB pastor prayed for me. I had gotten a good job also in prison. I was one of the specialists in prison for HIV. But when the homosexuality thing came in, America said, if you sign the bill, we are taking away the money because we paid by America. They went with their money, but for me, I was happy. I'm a parent. So I was like, I did not study to only work in the prison. So I want it to be very interactive. Fear is bad. I remember one time I was treating some Muse from Tanzania. He was 74 years. So this Muse was brave to ask me, how old are you, my son? I told him my age. He told me, even my last born is older than you. But what I was advising him, he even said, I feel ashamed listening to you, but you talk. Let me keep quiet. Yes, because I was feeling ashamed. But in medical things, we don't have shame. Totally, we don't have shame. That's why when you go to the hospital, you're a lady, they tell you, can you remove your underwear? One, check you. There is no shame there. Because how we are trained, one, even if, like when we were studying, we used to hear you're going to cut dead bodies, and I was like, I even fear seeing a coffin. How about a dead body? They told us one thing, respect the thing in front of you. If it's a dead body, respect it. It deserves respect. And I can assure you, in every university, including Makerere, Andrew, if you ask Andrew works in the School of Medicine. Last year alone, he told me 5 to 8 students ran mad. Every year, doctor students run mad. The moment you are handling a dead body and you don't give it respect, look at it like a living thing. Don't look at it like a dead thing, and you'll be okay. So when we are treating you, this is what I always do. When I treat you, I must forget what I've treated. Because you may even meet me on the way and say, Doctor, the medicine you wrote for me worked. I will be like, which medicine? I don't even remember. Because I also want to have peace. If I remember what I treated in you, I'll be stressed. So for me to have, because they tell us, at the end of it, I think you have seen most doctors where you come from, they drink. You drink because of the stress. The first time many people died in my hands, I'll never forget that Christmas of 2016. I never slept. I pulled my bed under the light. The light was on the whole night. So for me, I've learned you must forget When you leave the office, don't remember I treated Jane. She had this disease. She's going to die tomorrow. Learn to forget. So, here, though Pastor said send questions on WhatsApp, but let me first borrow some knowledge how we were managing people with HIV. The reason you don't see people dying of HIV these days is because of stigma fighting. When you hide your disease, you die faster. You'll be like, maybe let's say you have HIV, time for swallowing medicine has reached, but pastor is here, don't want pastor to know I have HIV. Time has gone, pastor is still praying. You're supposed to swallow at 7, pastor is in your house up to 10 p.m., you swallow at 11, those are problems. So when you're allowed to speak your problem, of course the one who goes and talks about you outside, that will be him or her with her God. Otherwise, we need to be as open as possible. But if you fail to be open, you will send it to my WhatsApp, I will read it. You can even remind me that please check on my WhatsApp there. And when we discuss here, when I meet you on the way, don't say, this guy knows me in and out. No, I must forget. Even after here, I must forget. Unless you tell me, if you tell me to keep your problem in my head, like, I will call you after 3 days. Yes, that's when I can keep it. Oh, 3 days, this one's going to call me so I can prepare myself. But if you don't contact me, I must forget. So, I am so proud of Pastor and the church for giving me this opportunity to talk to us. Only that I'm disappointed. I was expecting a whole church because this information is good for us. Most of the time we have suffered, and for us, a pen, sorry, I want to marker. Oh. For us in science, sorry, thank you. We have two things, faith and knowledge. We need both of them. They are very important for you to live long and to manage your life. In everything you do, those two things must interact. Now, Pastor, you'll forgive me if I go wrong anywhere in the Bible, in the church. You'll forgive me, but I'm doing my medical work right now, isn't it? For us, we believe that the line is there. Where I'll place that line, which side is bigger? The side for faith. And the side for knowledge is smaller, isn't it? And in the church, we know the meaning of the word faith. The pastor keeps on saying, please have faith, have faith, have faith. How do we define faith in the church? So what does he, yes. What does it say? Help me. Very good. So in simple words, for us in medical, we say, believing in what you cannot prove is faith. Because even God, you can't see God, but you must believe God is there, isn't it? Yes. So now for us in medical, there is this belief that if you have a lot of faith, then your knowledge is questionable. You have very little knowledge. But we want a balanced person. Because if I continue with that one, the meaning of health. Health does not mean the absence of a disease. But you must be balanced in 3 ways: spiritually, socially, economically. If you have money, you have a lot of friends, but you have nothing you are believing in, like you don't believe in a God. For us in medical, we don't care which God you believe in. You should belong somewhere. Whether you're Muslim, you're Christian, you must believe somewhere. For you to be healthy, 3 things must be in balance. Economically, you should have some money in the family. If there is no money in the family, there will be problems. The family is sick. You are fighting. Either fighting Satan or fighting your husband or your wife. You must have some money at home. Socially, you must have friends. You cannot be an island. That's why you come to church, like conference like this. By the time you go home, you have friends. You've made friends, which is very good. When you get a problem, you can call a friend, he helps you, you're healthy. Then spiritually, you must work on your spiritual world. That's what the church does. Only that I forgot my ID for doctors, but I think you have ever seen the cars for hospital. There is always that snake and that thing they write there in the logo. So I'm a person who went for medicine when I believed in science. I was like, isn't this a profession for Satan? I was the one who asked the professor in the class, why are we doing the profession of Satan? He told me, no, we're not doing the profession of Satan. He did not know the Bible, but he just asked me one question. Have you ever heard of any story in the Bible where God told somebody, get a stick and something like that? Some people got healed by that stick. So that was the first doctor. So we are doing the work of that man. Was it Moses or who? Aha. So whatever we do in the hospital, we also do God's work. Only that they warn us, when you're outside the hospital, don't interfere with the religion. Don't interfere whether somebody is a Muslim. Look at the person as a person. So let's come back here. Now, when you have this, I'm not encouraging you to have little faith. You must have faith, because I told you must be balanced. Those are the professors. They have a lot of knowledge. They have little faith. They also have a lot of money. But remember, I mentioned that you must have a balance. So even that person is sick, he has a lot of knowledge, he has little faith, he has money, he is not healthy, isn't it? So we want you to be in the middle. Forgive me if my pointing is not the middle, but let's assume that's the middle, isn't it? We want you to have faith to balance with the knowledge. Because faith comes with wisdom. Without wisdom, then you don't have knowledge, therefore you are not a healthy person. So, I don't want to dwell much on that one. I want us to talk about our lives. I was just speaking a lot because I wanted to make sure that when I'm here standing, let's be as open as possible. You may not say, I am suffering from this, because I have a friend. At the end, you get the knowledge. You go with the knowledge home. My friend has things like this. Pastor invited me to speak about the natural family planning methods, and I'm very glad. But one time, Pastor said, the reason I wanted the family planning method, this natural one, we shall discuss about the advantages and the disadvantages. He told me there was a child who was in some school, and the child was given family planning. And at this moment, I don't want to defend the school or defend the pastor. I first want to mention this, because it can also happen to any of us here. It's a learning thing. For example, the family planning method of taking medicines, the tablets that we take every day for a month. There is a time when you write for you those medicines as ladies. I will give you an example when. There's also a time when you don't write for you that medicine. For example, last week, in our training, we are trained not to come and look for you. If I see with your problem and you're not coming to talk to me, I need to give you your peace until you come. But of course, there is a human part of it. You say, but this man, this week he has not come. Last week he has not come. The other beards. Don't look around. If somebody is here with beards, don't look around. So this lady, I've known her since COVID, I think 2021. I call her and bewitched it. I told her, Auntie, what you are saying is wrong. Your auntie, the good thing, I don't know where she is. She didn't bewitch you. The reason I'm talking about this today, because I'm tired of this. I've seen you for a long time, and your problem can be solved. Now you are reaching an age where you are going to expire. Sorry if I use the word expiring, but I will do more. She was like, what should I do? I told her, I need to do these tests. Then she goes and brings out from the bag the tests I'm telling her to do. She did them. I told her, oh, you have seen from this test there's a problem here, so we need this medicine. She pulls out the medicine. I was given this medicine from the hospital, but I'm not going to take it. Why? Because this is family planning. And I want a child, but again, the doctors have given me family planning medicine. I told her, no. When you're doing family planning, we give you the same medicine. But when we are correcting another problem, we also give you the same medicine. So she woke up to take. Yesterday I was with her. She was 5 days into taking the medicine now. So, like bleeding problems, there are ladies who can bleed non-stop a whole month, 2 months, 3 months. They're bleeding. We give you those medicines. Whether you're a bishop, you're a pastor, you're what, we give you. Because if you don't solve that problem, still you may die. Then the church comes to pray for you and you go. So there is a time when we give such medicines, and there is a time when we don't give such medicines. So my apologies in advance, Pastor, if anybody is here in church and has been given such medicine. The only challenge is doctors don't talk too much. They don't explain to you why. Like for her, if they had explained to her why she's taking them, she would take them. But maybe the doctor had a long line. You just go right, go. They give you from their side, and you're like, I grew up knowing this is for family planning. And then the thing is to balance the body. Yes, actually, I'm happy that she's taking, because even she told me before starting the medicine, she had been bleeding non-stop for 4 months. So the medicine they gave her that I had also recommended, but she was already given, was for the problem. Now, family planning. Let's first talk about it in general. To plan for the family, there is planning for breakfast, lunch, and supper. When we talk of family planning, what are we talking about? Even that one's family planning, but most times when we talk of family planning, we talk about producing, reproduction, the child spacing thing, which is very important. Now, Pastor said this hormonal is very dangerous. I can confirm that indeed they can be dangerous. In that case, because those people who have beards, I have tried to draw the woman's system. It may look funny, but that's the thing. So this is what they call the oranges, where the eggs are produced from. Then this is where the eggs pass when they are coming to the nirvana. The women call this nirvana, the uterus. And of course, this is the outside part of you. So those ladies with the beards, depending, you have seen them. Some of them have a lot, others just have a few. They have problems here. They are swollen things there, we call them the cysts. Those cysts keep on producing some hormone that makes you a woman to develop beards. Those cysts, the more the cysts, the more the beards, and the more you don't produce. And these people here, because these are called cysts, so because there are many, we say that these women have what we call PCOS. PCOS in the full is poly. Poly means many. Cystic comes from the cyst. Ovarian, because that one, those oranges are the ovaries. Then the syndrome. So remember, this is where the eggs are produced from. Now, if these ones are swollen, the factor of the eggs, do you expect to get eggs? There is a problem. Depending on the severity, if you have a few beards, it means the cysts are so few, isn't it? So for this, and these guys can misbehave, and very fast they become cancer of the ovary. So for those people, one of the treatment we give is those very pills that we give in family planning, because those pills are hormones. We need to balance this woman's hormones, because she can also get a problem, assuming she's your, God forbid, pastor's wife, or who you don't want your wife to die, isn't it? So when we give her in that, the only thing is, when a doctor gives in a treatment, if he has not explained, go back and say, hey, but doctor, you gave me this treatment yesterday. I did not understand what is it for, because it may benefit you. Let me give you an example. I went to medical school when I had ulcers. I got the red lips when I was in P7. I got ulcers in P7. I did not treat my ulcers until I treated myself. One time, I went to the hospital. The doctors wrote for me medicine 2 times 3. Some of you know it very well. For me, I can assure you I was a fool. I didn't know which one represents the number of tablets, which one represents. I swallowed the 3 tablets 2 times a day. My friend from Tororo brought for me the medicine. He was a nurse already working with some organization. So when they lectured the next day, I was seated on the chair, but the chair was rotating. I was like, Elvis, the chair is rotating. He asked me, you taking medicine? That yes. Which one? I told him, when you don't know medicine. In year one, I didn't know medicine. I was like, the green one. He said, let's go out. Then we went and he bought for me milk. I took the milk and he took me to sleep. Then I asked, but Elvis, he asked me, how many did you take? I told him I took 3. Because he wrote there 2 times 3. He told me, no. The first figure, the first number represents the tablets. So I did not know. If I did not ask Elvis again, if he did not tell me, then I would not understand. You understand? So the Bible says, my people are dying because of lack of knowledge. Let's have knowledge. If you, in whichever hospital, the doctor may be there, is stressed also. People have stress. If he is stressed, go back the next day. You may pause the medicine and say, doctor, I was here yesterday. I did not understand this. And after all, in our profession, ideally, when I write for you medicine, I'm supposed to write my signature down and my phone number. That's supposed to be the rule by the Ministry of Health. You can call doctor at the right time. Doctor, can I meet you? When can I meet you? Can I come back to the hospital? I want to understand the thing of yesterday. It can be helped. So at least now, when you go to the hospital one time and they will write for you something that looks like family planning, first ask, and yet you didn't go for family planning. It means it is solving some problem, okay? It can save you, okay? For example, so like after medicine, I realized that there are some of our sisters who at home, they have not got married 32 years, 33, 34 without a child. You being 32, 33, 34 without a child, you have entered to a danger zone as a woman. The chance of you getting cancer of the breast goes up. Chance of you getting cancer of the uterus goes up. So now I realize that for these people, once in a while, you need to give them these hormones here to protect them. You don't want you to see your sister dead. Do you want to see your sister dead? You don't want. So knowledge is power. And knowledge from God. You don't have so here, I give you knowledge, but we as medics, we are warned, we don't choose for you which method. We want to give you advantages of the method and the disadvantages. Then you choose for yourself. So since the church chose, not only the church, even the cultures, mostly they choose the natural family planning methods. They are good. But I will implore the church, I will encourage the church, especially pastor, to have a room where to fight domestic violence as we start talking about our natural family planning methods. Because as you use family planning method, my brother I'm the second born in our family. I have my brother and my elder brother. One time he was quarreling with the wife. We went in there to solve the problem. He mentioned a funny statement. The statement made me laugh. But there is only one thing I picked from that statement. For us, the few men who are in this room, whether your wife has a PhD, there is a time when she understands like a woman who has never seen P1. That's for 1 week. For 1 week. And when you take history, those are the days when people are fighting in their homes. 1 week is very hard. And especially when it comes to these natural family planning methods, the best is to teach a man and his wife. If a woman understands it alone, it will not help. So I was expecting to get same number of women, same number of men here, such that this thing needs joint effort. Okay? Now, when we talk of natural family planning method, it's just a family planning method of child spacing without taking medicine. We don't take medicine, we just listen to our bodies, okay? We listen to our bodies. Like, for example, let's start with number 1. Yes. Long ago, our mothers never used to go for family planning. They could breastfeed their children, and the next thing is that the next pregnancy is after 2 years. You'll be wondering, what were they doing? But those mothers, they were not like the mothers of these days. Those mothers loved their children. They could breastfeed their children. So I want to talk of the first method. We call it lamb. The words, you may not remember the words, but I will explain every word. That's the one controlling birth using breastfeeding. From day one, the more you breastfeed your child, the more you delay to go back to the periods. But it is only effective for the first 6 months. After 6 months, because from day 0 up to 6 months, it is effective for around 98 to 99%. I will explain why it is effective in those days and how you can affect it. When a baby is breastfeeding, there is a hormone that, when the baby is breastfeeding in the baby's mouth, women understand very well. When the baby is disturbing the breast, you feel good in the brain. When you feel good in the brain produces some hormone. That hormone is for production of milk. Don't mind of the name. The name, you are not going to do an exam. Just know that there is a hormone the brain produces for the production of the milk. Now, that hormone is a chemical in the body. It disorganizes. There are two things. Let me be drawing here my cartoons. Assuming this is a woman, that's the head. Let's say these are the breasts, isn't it? Then the nirvana is down here. This system is down here, isn't it? So this hormone here, its work is to ensure that the milk keeps on coming. When it's doing that, it's disorganizing this route. There are also hormones that the brain produces to control this system here for you to produce the eggs. You understand? Now, when that hormone, it can't disorganize this one, meaning that now this one not receiving information to get prepared for pregnancy, to release an egg. If that one is not receiving information, you are safe. But now, how can it work? You must make sure that you keep on giving your child breast every 2 to 4 hours. The way God made our system is more than a computer. It must keep on correcting. When you bypass 4 hours without breastfeeding the child, the system is corrected. This one is not produced, so this one is open, isn't it? Meaning that now these ones are going to receive information, please produce the eggs. You get it? So our mothers, when we were young in the village, they could really breastfeed their children. But these days, the mothers who are working, tell me if that system will be blocked. It will be open, isn't it? That's why everything has the advantage and the disadvantages, and it requires working very hard. But in case you are a sit-home mother, now during the time you may manage. Imagine at night. That's why you'll be dozing. The moment you fail, and at night we want you to breastfeed not every 6 hours, 4 to 6 hours. 4 to 6 hours, wake up to breastfeed the child. If not, the system opens. And the moment these guys here receiving information from the brain, they start producing eggs. And remember, of course, I know, I didn't do arts in A level, but there is an African writer who one time wrote, you will help me, that as long as the bed is shaking, there is a peace in the family. Is this Chinua Achebe, something like that? That in a family, as long as the bed is shaking, there is a peace. You understand what I'm saying, isn't it? So remember, even if you're breastfeeding, the bed is shaking, isn't it? As long as these guys have received information, you'll get pregnant. That's the challenge with that one. However, it is cheap. We don't need to spend money to buy anything from the shop. So now, that's why I wanted to teach both men and women. The best way, as we continue learning about this method, is here. Don't use one method. You can combine this one with the one that we commonly teach women these days. You have ever heard of the word safe days? Have you ever heard about it? It requires a lot of science, a lot of work. It requires talking to a woman and a man. Then we tell the man that when she reaches these days, don't listen to her. Because whether she has a PhD and you are taught together on the same day, during that time, she doesn't understand. She will understand later. Then she will ask you, I thought you knew. The next thing is fighting, and by the time you realize you can't come to church, the eye is swollen, you fought last night. You understand? Now, so I hope you have understood this one of breastfeeding, isn't it? So it requires regular. Now, why is it effective for the first 6 months? It's because during the first 6 months, we encourage you from the hospital not to give the child any external food. The only food the child should know is the breast milk. The moment you introduce the food before 6 months to this baby, the baby will lose appetite for the breast. And the baby will not breastfeed. And the communication will be corrected, isn't it? So we tell you for the first 6 months. And when he says 6, I see there are parents who think they have money and they have started doing stupid things. Sorry to speak the word stupid in church, but just a bad thing. These are, you see parents who buy the thing they put in the baby's mouth and the baby keeps on sucking like, you know it, a pacifier in English. Now, as long as the baby is also having a pacifier, you have broken the 6-month rule because the baby will be receiving that is suckling. It takes a lot of saliva. You give the baby breast, he refuses. So you can see. Now, why doesn't the method work very well after 6 months? You have introduced food. I think mothers, you know, sometimes some babies refuse the breast on their own. They feel like the food outside is enough. Breast, they leave it. The moment they leave the breast, the system gets corrected. God's system, the way God made our bodies, and you can disorganize it a little bit, but it must correct, isn't it? Now, I don't know whether you have understood how this one works now, isn't it? So it requires what we call exclusive breastfeeding. Breastfeeding without giving any other thing. Then the times. The more you breastfeed, the more the body produces this guy here, the hormone, the more it disorganizes this communication here, the more you are safe as a woman. All together. That's number one. So this one, the more hours, the better. Then the advance of that one, the more the woman breastfeeds her baby, the more she connects with the baby. When we were young, our mothers and their children, they were so much in love. But these days, even a child can abuse a mother. The connection, you just hear, that's my mother, but so what? You're my mother, so what? So the more you breastfeed the child, the more you connect with the child. All together. So that's a very good. It has many advantages also. It's not that it only has disadvantages. Then number two, when I was in Ngoro High School, I was there for 6 years. But for all the 6 years, I only heard that there were only 2 people who had allergies in the school. When we were young, were you hearing about allergies? These days, I think you hear even the neighbor, somebody has allergies, isn't it? The more you stop breastfeeding your child early, you make the child to enter into the danger zone of allergies. The breast milk has chemicals that make the baby's body to accept most of the things. Allergy means the body has refused some things, you understand? Now, it is even more worse when you introduce, I know even us when we were growing up, they could give you cow's milk as early as possible, but at least you still had mommy's breast. But these days, they give you the cow's milk from the shop. Mommy says, I don't have milk anymore. You will grow up with allergies. You have a high chances of getting allergies. You're the one. It is called I'm allergic. I'm allergic. That kind of nonsense. But for us in the village, like in the whole of our family, you breastfeed. I can even, sorry, if that woman was alive, I would apologize to her. I remember I breastfed my mother when I was 4 years. My brother who was following me was breastfeeding after lunch. I was like, is this thing sweet? No, you can't remember at 4 years. I also stole the breast and I breastfed. I realized it was not even sweet. Yes, so things like that. So breastfeeding. Then next about breastfeeding. This method encourages breastfeeding. Your baby will be having a stronger immunity. There are chemicals within the breast milk that make the baby to fight disease easily. You don't breastfeed yours, you as the one who's always sick. Like, oh, man, again the baby is sick. Again the baby is sick. And that one is going to affect the pocket of the husband and the whole family. Even you cannot have sleepless, you cannot enjoy sleep. This week the baby is sick. So the doctors end up knowing you, your whole family. In fact, a doctor should not know your name. You should only greet, hey, who's that one? But if the doctor knows your name, even calls you and says, hey, these days I'm missing you, then there is a problem in your family. Hey, a doctor should not know. You should not know. You should go there once in a while. When you meet him again, say, hey, I forgot, what's your name? Hey, yes, you were here some time ago. That's a clean body. But if you're the one who is going there as if they are giving break, lunch, supper there in the hospital, you're not a healthy person. So, breastfeeding, your baby will be stronger via the immunity. Now, my next, as some people are here older, the children of long ago and the children of these days, must they tell me, which ones were wiser? Common sense, when you talk of being wise, forget about that these days they are passing in school. We are dealing with the common sense. Yes. Yes. Yeah. Very true. Very true. Mm-hmm. What today, and they had posted there. It looked like fun, but for us medics, we know that there is some knowledge here. That suck a breast to save the mother, to save the woman. When your breast is sucked, when the baby is sucking your breast, some of these cancers, cancer is just your body to start misbehaving. Cancer is not like malaria that the mosquito has to bite you, inject you, then you get it. Your body, just like you have all your children, 10 children, then one child to misbehave, we would call that child cancer. Your body can misbehave to fight its own. So when you're breastfeeding, some chemicals are produced from the body because of that simulation that protects you from cancer of the breast. For us, we know in the hospital, you are a lady, you're waiting for the right man. Pastor, I'm not against you. And you're a woman who is 35 years, you're still waiting for the right man. These days when I got the village in Teso, there is music in Teso that we don't hear here in Kampala. There is this song that if you go drink your alcohol, then you spoil your liver, you go to church. Yes, God may forgive you, but you also suffer with your liver. Have you ever heard of that song? I like that song so much because it speaks sense, but somebody may not see sense there. So you stay for 35 years, you don't want to produce, you get a man later on, yes, God will bless your wedding, and pastor shall be happy in the church, things like that. But when the cancer of the breast comes in, you'll also be with your breast cancer. So we need to be very, very wise. As ladies, not men. Men don't have expiry date. Not that I'm a man, I'm speaking for men. We don't have expiry date. No wonder even long ago, even Abraham himself. No, not Abraham. Let's talk of Adam. Eve and Adam, I'm sure Eve was younger. Pastor, by the time God created Eve, I don't know how many years Adam was having. But he was an old man, isn't it? So men do not have, the only challenge with men, in case a man is old and he produces it, you are 40, and they like deceiving, get an old lady getting yet you are 40, and they like deceiving, get an old lady getting married to a young boy, which is not a problem. You want you to get married, but now your body is still safe. Okay. So that's about that one. Let's go to the second. But let's go to the second method, and I am sure that's what most people would want to know, the safe days things. That one, because when you talk of natural family planning method, somebody wants to understand the safe days. Very good. I want to talk about that. Do you have another one? Oh, I can pass. Okay. But as they are doing that, I don't know whether there's anybody who has a question about this, because I have not exhausted all the explanations here. But the most important thing I want you to pick here is for the method to work, the timing of breastfeeding is very important, isn't it? Because we want to disorganize the system. We want to disorganize your body. Remember, this body cannot be disorganized forever. It will be disorganized. God made a perfect body. God's body needs to get better. So the moment you misbehave or you don't follow the timing, it gets corrected. Any question about the first one?
For me, I have one question that
Yes.
is on breastfeeding.
Yes.
You said that when a mother is breastfeeding,
Mm.
it helps her in either avoiding her to get cancer
Of the breast?
of the breast.
Yes.
Others even it helps their children to boost their brain. Very many things you mentioned.
Yes.
But on my side,
Mm.
me, I want to talk on my side because me,
Yes.
I was once in a straight talk club.
Yes.
I am a mother who has so far given birth in different types, Sicilian, normal, and so forth. But
Yes.
now, I am a woman like I've been scissored.
Mm.
I'm told that when you are scissored, you only take 6 months, then you go back to your normal periods. But for me, strictly, 21 days I'm in it, whether normal or scissor. And on top of that, I always have little milk.
Little bleeding?
Little milk.
Oh, little milk, yes.
The moment I give birth, 3 days, no milk.
Mm. The first 3 days?
First 3 days. Even if the nurses forced me to give that baby the breast, even themselves one time tried, no milk. Then when it comes with the force. For roughly 1 to 2 months, it reduces. The baby will suckle until it gets tired. You really see that the jaws are tired.
Yes.
The baby will end up, when you get a man who wants his child to have only breastfeeding, he will tell you, give that baby milk. Give the breast.
Yes.
Give my baby to breastfeed.
But the milk is not there.
The milk is not there.
Very good. I like that. The woman, like there is a woman in our village. The man is a farmer, but the woman had to force a man to marry another woman because she was like, the work is too much. Maybe the work is too much just at home, and many other things. So you needed a long talk to discover how is your feeding like at home. What's your relationship with your husband? If it's good, what's the nature of the jobs you do at home? Do they take a lot of your time? Do they stress you a lot? Do you have made things like that? You get it? But no, it's not. It's all about that hormone production, which is produced. When you're treating someone to become stressed. Otherwise, if you can manage very fast, you call it the person. No, don't give me the tea with the sugar. The other side, Pastor, I know after this, we shall have jerry cans for water in the ladies. I want them to learn. I want them to learn. It is a good thing. So that thing, at least I buy it a lot from the Muslim people. Indeed, I can assure you, those people, the ones who have infections are the ones who have also started coping in some life of Christian ladies. Amen. Yes.
I used to have infections, but my doctor advised me, don't use TP, use water. Since then, I've never treated an infection.
I don't come with her from the same home, but you can see that. But for the learner, I can also train how they use water. For the learner, you can use it, toilet paper first, clean, follow with the water, isn't it? Otherwise, men here want us to, all of us in our families. In my family, I only buy toilet paper when there is a visitor. You don't want to stress a visitor. Yes, you do, when you go to Rome, do as a Roman. Don't stress people, okay? Otherwise, we are told, toilet paper for what? It's not a right thing. Then there is also the notion of bikers, family planning. Otherwise, I would talk, and here I have energy, unless you're hungry. We can talk the whole day. You have a question?
Yeah, I do.
Yes.
I wanted to know what's the recommended age to stop breastfeeding.
2 years. 2 years or something approximately 2 years, meaning that nearing 2 years. I like that. Let me do some more explanations here about breastfeeding. We all come from communities where we have babies who are sucking fingers, biting nails. The other day I was driving in the jam. I saw a man biting nails. When I looked at him, he felt ashamed and he put it down. I did like this to show him that I have seen him. We know that, isn't it? Now, there is what they call, you do it little, you get affected. You overdo it, you get affected. Fixation. When a baby to get affected. Fixation. When a baby does not get enough breast milk for 2 years, he has to enough breast milk for 2 years. He has to compensate it by this. Do your research. A baby who has breastfed for 2 years or nearing 2 years, you don't get them biting. You don't get them biting. It is these ones who have done it less or over. You get it? It is these ones who have done it less or over. You get it? Again, too much of everything is what? Give like that. Can they, is there something missing? They will not, isn't it? Isn't it? Yes.
Some mothers who
Yes.
some mothers who they force the baby to suckle their.
Yes. You see things like that. So this is a good interaction, and I pray it continues when it's open like this. We learn a lot of things, isn't it? And that's why I go back, and I will always be thankful to pastor and the church for this decision. A church to start this. You know, when the phones were coming, I was young. They said phones were Satan, isn't it? Now everybody has a phone. Oh, by the way, when I left home, I knew I was coming to teach about family planning. But in me, I was like, this not be nice. The best would be having a group of people who talk about all things in general, because we don't only have family planning issues disturbing our bodies, like this one now, isn't it? Now, let me first explain here. Whatever food you eat in your life, the body must convert it to sugar. Now, this sugar, the body can break it down to produce for you energy that you need at that moment for walking, running, whatever it is. In case you have eaten and you have not done anything, little will be broken down for just the heart and the body to function normally. Otherwise, the other one will be converted to these ones for storage. That's why when you eat, you don't do any work at all, you go and sleep, you keep on gaining weight, because the sugar the body has got from the food is converted to fat. It is stored, isn't it? You become fat. But now this fat here, during starvation like fasting, the body is supposed to convert it again back to sugar. Then now the sugar is broken down to energy, isn't it? Now, looking at your body, I don't know about those days when the doctor told you whether you're looking like this or you're not looking like this. If it is the same body, I don't know whether you had gone through long fasting, because ideally you need to, you going back to sugar. Oh, I mean, the reason for your sugar level to come to 3 points, it's not because you left the other sugar. It is possible that these are stores, idulai. It means that it is possible that your fat stores are not enough, and you had gone to some level whereby you did not have, this one supposed to be in blood. That's why I say blood glucose level, isn't it? Maybe this one came down, and the stores were less, so the body kept on reducing this one. By the time they checked, this one was less. If you just keep on eating, not only fruits, just food, any food, your sugar level would be okay. It is only people who are too sick that they don't eat, and they're also tiny. When they are tiny, the stores are not there, isn't it? And they are very sick. If you don't give them the sugar, the blood sugar will come down and they can get a problem. So, just now for you, we just advise you, even if you can go back to your life of no sugar, but make sure you eat 2 to 4 hours, something small. 2 to 4 hours, something small. Just because you want to keep on supplying the body with food that will convert to glucose for your normal functioning. You get it? And that's why pastor is out, but you can still guide me. Medically and scientifically, the dry fasting thing, for us, we would have issues with it, but we are trained not to interfere with people's faith. Dry fasting, it requires you, that's why for some modern churches, they tell you first speak to your doctor. The Muslim school I teach, of course, you know, they are still having their fasting, Ramadan, and how they call it, whatever they call it. And the way the kids are collapsing, I always tell them, if you're tiny, what are you doing fasting? You're tiny, your stores are less, you're not supplying food, you're going to collapse. You get it? Then, of course, also with the fasting, would want you to talk to your doctor. If you have ulcers, you have no time fasting because you're going to die. Things like that. So, if you go back to sugar-free life, make sure you don't. There are people who wake up in the morning, they go for work, they wait up to lunch, but even lunch they have delayed. They eat at 4. That's dangerous. But if you eat 2 to 3, eat something small. And when we say something small, it also goes to feeding. A healthy meal is not supposed to be bigger than your fist. A healthy meal is not supposed to be bigger than your fist. Now, when you eat the meal which is like your fist, my friend, don't eat break, lunch, supper. You will die of hunger. That's why I see for Bazungus, after some hours, they're eating menvu. After a short time, they're having a fruit. For us, we have a hollow plate. And then we become fat, isn't it? So things like that. So I think if I'm to carry out good history, there could have been a problem with your eating hours. The ranges were long. I don't know how you eat. Because what other thing can make the sugar level to come down? Of course, sicknesses like malaria. For the malaria parasite to grow, it needs the sugar. That's why when you have malaria, even become weak, you need sugar for it to grow. So if you have other, we call it underlying illnesses, it is possible during that time. Now, that's why for us, whenever the sugar level comes down, please at that moment, whether somebody is diabetic, give the person sugar. At that moment, of course, you give it in a drip. If you are far, like you're in a church and there's no drip, get this glucose from the shop. Don't get this sugar we use in the tea. That one to produce glucose, it has to be digested, a long process before it gives you energy. That's why when we were young, during athletics, we were using glucose because glucose can be absorbed from the mouth here into your blood and you're okay, isn't it? So when your sugar level comes down, the solution must be give. Then you advise the person, have small regular meals. Small regular meals is what we advise people. You don't eat, I ate lunch, breakfast at 7. Then you wait up to 1. Depending on how active we are, the glucose in the blood may come down. It will reduce and always the sign of the funny thing is that when the sugar comes down and when it's too high, it can lie you. Even when it's too high, you can shake. But if you're a normal person, I think we all know hunger. When you're hungry, don't you shake? It means it has come down because it is required for normal function of the muscles and the nerves and things like that. So that's the thing. Small regular meals. It doesn't matter which meal at that moment, isn't it? Small regular meal, as long as whatever you eat, the body will convert it to glucose. Now that glucose, either for you to continue with your work, it is converted to energy, or if you don't spend it, converted to fats and you grow fat. You understand? It's not about because you had left the sugar in the tea. No, it's because your feeding hours probably maybe they were longer, the intervals, they were longer. Yes?
Our church,
Yes.
we are based so much on prayer and fasting. And of course, amongst us, as you are encouraging regular meals, of course, it can motivate people to reduce their, depend on it that the doctor said that, I should be having regular meals. Just not to stray us,
From
stray
faith.
other, some people from faith. Yeah, I just want to tell, of course, the rest of our colleagues that, of course, that the doctor is saying is really good, but of course also should strengthen our faith as we carry on. If it's fasting, we can still make it because we are all here. We have been able to go through it and keep our nutrition and health living, even when we are fasting.
Yeah, by the way, to strengthen our point, I don't want to be misquoted that I am discouraging fasting. Medically, fasting is also very good. because we don't need to supply the body with food all the time. Sometimes the body needs to use the stores. In our villages, if you keep food in the store, edula, and you don't use it year in and year out, what happens? It will get rotten, isn't it? And that's why even cancers are common in obese people, people who are fat. You are having stores, you're not spending them. Then too, fasting is just good for your soul and the spirit world. So when I talk about it, I don't say now, okay, Pastor, from today onwards, I don't want to hear the program of fasting, my friend. However, in the fasting, the churches, I'm sure they will have some, if you are sick, I don't know that you're allowed to fast because your body needs food. There are people that you cannot subject them to longer fasting. You can give them what we call intermittent fasting, fasting for hours. That one, somebody can manage it like that. But if you are big and you don't have any other underlying, it means you have enough stores. You can go for a day, 2, things like that. Get it? So fasting is medical fasting. Even if we sometimes tell people, even if you don't have faith, but you are big, please tell you to fast. Fast means you leave food. We don't care whether you're going to pray, you don't go and pray, but it's good. We want you to use the stores. You get it? Yeah, so I'm not discouraging the church fasting. However, this one, because last year when I was in Kapelebyong, I'd gone there to do some small rice there. There is a lady who died in some church. You must have heard of the story. She died under some circumstances. Not only that, and I've heard a lot of them also. I would also, this one, for us to be safer, because I don't think the government will be happy to get somebody dead here. If somebody has chronic ulcers, whether big or small, I would recommend, Pastor, that one. The longest is 6 hours fasting. The reason is ulcers scares us medics, doctors, when it starts bleeding. How do you know you're about? If you have ulcers and you start vomiting blood or diarrheating blood, for us we know that you are close to going. That's when you get us running in the hospital. But if not yet bleeding, yeah, I have ulcers. You get us walking in our style, even on the phone. But you come vomiting blood or diarrheating blood, because we know ulcer is a wound. That's our medical word for the wound. In the hospital, we don't say wounds. We say, because you can even have ulcer on the skin. When you fall down and you get a wound on the skin, we say skin ulcer. Now, when it starts bleeding, it means that it's getting perforated. A word for perforated is getting, can I say, it's developing a hole. And the contents in that are supposed not to go outside the stomach and the system should not pour out because they have a lot of bacteria. If they pour out, then there will be general body infection. So that's why before I came to this church, I was praying in Watoto. And in Watoto, the pastors would say, maybe we'll have a program of fasting, dry fasting on such and such a day, but before you go there, please visit your doctor first. And when you come to us, we don't check you for HIV, no. We check you we want to know if you are diabetic, you have that sugar disease. You know, the funny thing with the diabetes, you may only assume they only have high blood sugar, but can come down anytime and they die. So diabetics don't allow you to go for long fasting unless you keep on testing blood as you're fasting to monitor them. If you have ulcers, we medically, without contradicting with the faith, would not recommend, for us to use careful words, recommend, such that even if you go for it, we are safe, isn't it? We don't recommend you to go for fasting when you have ulcers. That's our medical stand. But still, when you come here, you make because even you can come to church, the hospital, and say, "Doctor, I've written this medicine. I'm not going to take it." We don't beat you because it's your choice. Medically, to be safer until you first treat ulcers, and of course, ulcers heals. Okay, the people who lie that doesn't heal. You know, in treatment, we are trained in 2 ways. We are trained to treat difficult people and simple people. If you are difficult and you come to the hospital crying, our target is only to make you go back not crying. We don't care whether the disease has gone or it is there. We just want you to go back home feeling better, isn't it? That's why I always ask people when you go to the hospital, And they have given me medicine for ulcer, but this thing is not going. You ask them, for how long were you given the medicine? Medicine for 5 days. That now you know we are treating a kajanja person who does not listen. Because for ulcers to go, that bacteria is a very stubborn bacteria. 5 days, 1 week can never kill the thing. That's a total lie. It's like fighting Satan. Of course, fasting makes you stronger in spirit to fight Satan, isn't it? Yes, so if you have a bigger problem spiritually, you need to fast and the problem moves on. When you tell me you're taking medicine for 5 days, 1 week, my friend, it will cool. We call it relief. That's our language in the hospital. Relief. Relief means what? In Luganda, okukakanya. In Ateso, etilim. It will come back. We're just relieving it. To clear ulcers, we need to take medicine. There are those ones take 4 days. But in the stubborn ones, you may go for 60 days. Imagine giving drugs for 60 days. You will go to the witch doctor. You will say, this man wants to kill me. Like the other day, I worked with a lady who was telling me, I was seeing all the time, I was telling her, now for you think ulcers is the fashion now. I have ulcers. I told her, the day it will become cancer. Because in Ateso, any wound that does not heal, isn't it? $1 becomes a cancer easily. So any wound you keep in the body, you don't want to cure it, it becomes a cancer very fast. So that thing of like, it goes, mine went. I'm here. Then I'm happy. When I was at school, I was like, because me and Andrew, I met Andrew when he was in A level, I was young, but when I went medical school, I was like, I'm here first for my family and my friends. I also cleared his ulcer. If he comes there, he will tell you, I don't know, but he was a hard person. He was a hard, because he believed it could not go away. It was very hard, but it also went. So for those I've treated, I'm happy. So I don't contradict with the faith. Fasting is very good, spiritual, not only spiritual. Even people who are managing weight, the people who don't have time to run, we tell you to go for intermittent fasting. Allow the body to use the stores. When you don't use the stores, the food gets rotten. For us, when the food gets rotten, when they serve, when the fats get rotten, they will misbehave and you get a cancer. And that's why with obesity, cancers of any type, they can visit you anytime. We know that a fat person, if your BMI, there's what we call BMI in the hospital. The body mass index, everybody, according to your height, the maximum number of kilograms you must have. If you pass the normal BMI, whatever that has brought you to the hospital, unless maybe you have got knocked by a bicycle, but even that you can say you would have run away. If you're light, you would have jumped. You don't get surprised when you come to the hospital. Fasting is good, both for the body and for the spirit world. You get it? However, when you go for fasting, you don't, what the other may do, if you are not safe for it, don't fast. First correct the mistake, then you also fast later. I get it? So that's about fasting. So can you go to number 2? Oh, we are still enjoying this. Number 2 is the safe days. And I would not want to go away before I teach about the so-called safe days. Okay, question there? Yes. Yes. Yes.
I have realized of recent that I begin even fearing to eat, because situations that when I eat, and most especially when it comes to like supper, you find the stomach becomes full, and then you have this heartburn, and then another time even it doesn't allow you to fart, like gas remains, and then it wants to be coming back.
You want to exhale it.
Over you call it bloating, bloating over
bloating is swelling, then coming out is belching.
Yeah. But then you try to sleep in that kind. Another time you find like the food is coming back, as if it wants to choke you in the sleep. So I begin wondering. I've not taken a test for ulcers of recent.
Yes.
It was, I think, in December 2022 that I tested positive for it. But ever since that time, I've not done the tests. I don't know if it is the very ulcers that behaves like that or any another thing altogether.
Yeah. Good enough you mentioned you tested positive for it. But there are also other reasons why you may bloat. you feel like there is gas in the stomach. One of them can be visitors in the stomach. Visitors, the worms. You know, some of us don't maintain the 3 month, timing. Every 3 months need to. Then number 2 can be the nature of the food you have eaten. I don't want to spend the other side. The other side is for other methods. When I draw here, I don't know whether you will see it. My diagram may be poor, but I'm assuming this is the stomach, and this is the esophagus, isn't it? Every human being, not only human beings, animals. I think you have seen when a dog eats, for example, a rat, the only thing coming out in the poo is the hair. You don't see the bone, isn't it? When a python, I know some of us have never seen a morotot, a python. When it eats something, it remains there sleeping. It has to digest whatever it is. When it poo-poos, you don't see any bone. Every animal has very strong acid here. The acid is called hydrochloric acid. That acid does a good job there in the stomach, but it can misbehave. No, for it doesn't misbehave. No, it has to misbehave. Now, this acid, number 1, sometimes you eat food without washing hands, meaning that you take in food with the bacteria. Now, this acid can kill the bacteria you've eaten with the food. Number 2, there is some digestion taking place in the stomach. And for that digestion, it requires what we call a pH provided by an environment provided by the acid, isn't it? So it does many things there. Then number 3, okay, there are just a lot. I may not go to, because we're not going to go for exam. I only want you to get what you need to. Now, also, ladies, you have ever prepared bienda, amwateka. Bienda, it has that slippery thing, isn't it? That slippery thing is protecting the walls, okay? And even the stomach has a slippery thing. But our esophagus here, that slippery thing is not there. So, there is kind of a gate here. That's why even when you're playing, like the legs are up, the food cannot pour out because that gate is blocking, isn't it? So some spices we put in the food, they can disturb that gate there. We call it a sphincter. And it opens. When it opens, the acid here splashes. When it splashes up, remember this side is not protected by the slippery thing, isn't it? And acid, you have always watched on TV, acid. Remember that acid is very strong. It starts burning you, the esophagus, again, isn't it? That's what we call the heartburn, because the acid is actually burning you where? It's burning you there. And it's one of the causes of cancer, because cancer of the throat, because when it burns you there, it puts their wounds. And when a wound stays for long, becomes Ebola. Ebola becomes a cancer, you understand? So the spices, what makes this one can be spices, 2 can be just other infections that can attack this gate. It starts opening, the acid starts coming out, isn't it? Number 3, our sleeping posture. Of course, when you overeat food, because the acid is supposed to be down here. When you overeat food, the food pushes the acid up here. Madam has given a full plate, finish my food. If not, you have eaten from another madam's home. The food up to here, the food is full up to here. When you're sleeping, it will be pushed here, the gate will open, some of it starts escaping up. By the way, it's also one of there's what you call sudden unexplainable death. Some people can die because when the food comes back, it can go to the lungs. We call it aspiration pneumonia, and you can die. And you have ever realized when you vomit out something, isn't it very bitter? Because of the acid. The vomit is very, very bitter. So what we tell you, away from ulcers, treat ulcers. Number 2, in the evening is you have no business overeating as a normal person. Don't overeat in the evening. Your breakfast should be heavy. Your lunch can be heavy, but supper should be little. You understand? But treat ulcers first, such that when the problem persists, when ulcers is gone, we shall now think of another thing. But also, whenever we talk of ulcers, talk about ulcers before we go to number 2. There are 2 types of ulcers. There is ulcers which is commoner, caused by the bacteria. Now, whenever you go to the hospital, you're complaining. Of course, we test your blood because we are looking for the evidence that the bacteria is present in the body. But there is also ulcers. You have all the signs the other one who had ulcers is having, but you test, It's negative, but when you scan, we shall see wounds. We call them mechanical ulcers. Now, those ones, when you take long without eating food, the stomach is empty. For example, we hear in church fasting, the neighbor is frying food there. That aroma, aroma from the food, the smell of the food, of course, through the nose, tells the brain, that's a nice smell. The brain at that moment does not know that food is yours or not yours. It doesn't care. That's why I think you have ever realized when you're here and in a short time you become hungry. You feel like the stomach is doing what? Is boiling, turning. So when the nose tells the brain, that's nice food, the brain tells the stomach, my friend, what's coming is nice, prepare. How does it prepare? It only prepares by producing this. Number two, the system has to empty itself to prepare for visitors. The food comes, isn't it? That's why in a short trailer you want to go there because the system is getting ready to receive. That's why we tell even in ulcers, avoid spicy foods because of that. Somebody may not understand. What do you mean by fried food? In short, any sweet-smelling food you need to avoid during that time because we don't want this one to be secreted in much amounts. You get it? This one here, the acid. So, now the people fasting, you may even test negative for the bacteria one, but you still have ulcers. And the good news is that the treatment is the same. We don't care whether you go to the hospital and you say, oh, we have tested your blood. And of course, sometimes people come, they don't even have money for scanning. Otherwise, when you scan, we shall see wounds in the stomach. In case of the mechanical one, the one caused by the acid, not this one. Not only the acid, even some strong spices in the food, they can erode the walls of the stomach. Some people like very spicy foods. Very, very spicy. Even eating what you're crying. Okay, that's the mouth. How about the stomach? I guess you know what I'm talking about, isn't it? Now, all that is called mechanical. We test for it in the blood. It's not there. Of course, in the government hospital, we don't have stress. We don't have to go back. But in reality, you also need a treatment. You get it? So first treat ulcers. Then for the bloating, also the bloating can be caused by the spices, can be caused by the worms. That's why 3 things I would advise you. Treat ulcers, deworm regularly, check on what you eat and the amounts, and you'll be good. You get it? Yes.
Through praying and fasting.
Mm-hmm.
And then I also realized that there are some kinds of foods that I had to avoid.
Correct.
One, the GMOs. Whenever I would eat, I would have the same complications.
Yes.
But when you get it from something natural, honestly, I will not.
Yes.
Bring 2 types of bananas here, the GMO
And the other one.
and the other one. This one I will begin feeling even coldness. You feel I'm shivering at the same time. I will begin bloating. You are belching at the same time. You're going to sleep. You have no peace. I believe, I don't know whether it is safe or it is just on me alone, but that is what I realized.
Thank you.
Most of them are caused by the GMO. To me, to others I do not know, but that's how I managed it all.
Thank you. Now yours, we are not here to fight, but we speak facts, okay? It's not caused by GMOs. Can be psychological. But in fact, if I was to speak about ulcers, it takes a whole long time. There are some foods indeed that can predispose, that can make the stomach produce a lot of acid. I've just talked about the spiced ones, but also any food that has a lot of starch. For example, when we eat cassava, don't we get heartburn? We get heartburn, isn't it? Because cassava has a starch that requires, for the starch to be broken, the acid must be produced to break the starch. Number 2, who has ever eaten beans which is not very ready and gets heartburn? The bean is not very ready, you must get heartburn. Because when you take it there, the stomach must complete the cooking. It doesn't have fire. It only cooks using what? Using the acid. And when the cooking is over, the acid now continues disturbing you. You get it? So it takes a lot. It takes a lot. Starchy food, spicy food. I am seeing the person is seeing the time before we even go very far. I'm sorry, but that will be another one. But let's first help our mothers. Okay, okay. Everybody. Okay, okay. So, okay. So should I go to number 2 or we still talk about ulcers? I know ulcers attacks. A little bit more about ulcers. Why is getting prevalent a lot in the communities? This bacteria, H. pylori, that causes ulcers. Like I told you, most ulcers are caused by the bacteria. It is spread in the saliva. When one member in the family has ulcers, let's say dad, mom, whatever it is, remember in the same family we share the cups, we share the forks and the spoons. And when you have gone for work, there you go and eat from the restaurant, wherever it is, that bacteria spreads in the saliva. Of course, the other ones, they have tried to wash the spoons, but they will not be very clean, isn't it? That's why it's prevalent. And indeed, when we were studying, in the books used to say you can't get a child below 12 years with ulcers, but these days I get even the ones of 5. Yes. So in fact, when you're a parent and you have ulcers, to save the family, treat your ulcers. Otherwise, it will not take long before you hear your daughter also has ulcers, the mother also has ulcers, and others. So treat ulcers to save the family. And treatment of ulcers, be patient and endure the drugs, isn't it? And treating of ulcers, they can give you the drugs I told you can be for 30 days to 60 days. We treat ulcers in 2 ways. There is using the drugs and behavioral change. During the treatment period, there are some things which shall tell you not first do. But not forever. Like when they tell you don't eat this one, it's not forever. After some time, like when they tell you don't eat oranges, just for 6 to 8 months. The reason we tell you not eat, the wounds on the skin, they heal faster than the wounds inside. For the wound to heal, we need air, oxygen. In the stomach, the air is not entering there. So that's why the other ones take longer to heal. Remember, when the wound is healing, the first thing is forming a base, a layer, a strong layer, isn't it? So the other one, the layer may form, can provoke it with the acid. Even after clearing the bacteria, the acid peels off the layer, again the wound comes back. Then you say ulcer doesn't heal. We combine 2 things, behavioral change and the drugs. You understand? Don't only take drugs, but you continue with your wrongdoing. You will not heal. Because even if the bacteria goes away, the wound stays. The GMOs, maybe what my sister is saying, it is possible that you ate a GMO, the genetically modified foods, the organisms. But the GMO you ate, it had a lot of starch, and the starch attacked you. You get it? Otherwise, I'm not here to promote GMOs, but it will be wrong for us to say that GMOs cause ulcers. No, it can be even any other local food, like cassava, which is not even a GMO. It has a lot of starch. If you eat it too much, you'll get heartburn. It's not a GMO, but you have got heartburn, and the heartburn is disturbing you. You get it? Because the acid is the one disturbing you. Yes, then about to pray and to went away, we are told to be in our profession, to be very careful with the faith. We don't interfere with the faith. Okay? I know God is everything. God can do everything. Yes. And maybe the one you had was mechanical. Mechanical doesn't have drugs, doesn't need drugs sometimes. You can just become careful with your lifestyle. The wound heals and goes. However, for the bacteria, number 1 is God. God can do everything. But we also need, as number 2, drugs for the bacterial one, the one caused by bacteria. We need also drugs. You can pray as you take the drugs. So that's why we say in the treatment of a person, there is combining different sectors. The religious sector, the hospital, that's medical, and any other. So we need all of us, the different parts for the different departments for solving a problem. Any question before we go to 2? Or we go to 2? Yes.
As for us, the order of the day is most of the time is fasting. And you are saying at least once in a while don't have too prolonged fasting. I'm just requesting you to help us with the food, at least which we can eat, to help us to get our glucose faster and the fat, so actually the things which can bring us, yes, yes, sir.
That's a good question, and I've been also advising the Muslims. After fasting, the stomach is empty. Avoid putting acidic foods in the stomach, like the pineapple. Have you eaten pineapple after fasting? There's acid there. Oranges and orange juices, you don't need them. In fact, what you need a yellow banana. You don't even have time, you should not even take passion juice. Even passion is very acidic. Please keep away from passion. You need a yellow banana, you need milk or yogurt. You can take juice from watermelon. Watermelon is very friendly with the stomach. You can take juice from carrots. You can take juice from cucumber. You know, there is this cucumber they sell in town, green, wasn't it? Those ones are free. I don't know very many others, but the things I clearly have, I can remember that should keep away from. Pineapples when you're fasting. Oh, you're pumping a lot of acid there. There's a lot of acid in pineapple. Keep away from oranges. Orange juice, whatever it is. That's why we call them citrus fruits. And then oranges, lemon, you keep away from them. And sometimes I may not even mention all the list here, but some of the things you eat them and you really see, they have disturbed me. It means the body has warned you. Keep away from that. But the friendly things that I'm sure about, they have less acid or no acid. Watermelon, carrots, yellow bananas, cucumber, pawpaws. These ones are okay, very okay. So that's what you can do. Avocado is very excellent. I tell you that I may even forget others. Avocado is very, very excellent. Or I repeat the yogurt thing and the milk thing. Why milk? That oil in the milk helps to cover the wound with some layer of oil, and the wound is protected from the acid. That's what we do. One time I was advising a reverend. There is a reverend, a reverend of this Church of Uganda in Kichintale. He was like, I was treating for ulcers. I'm a reverend. I was like, Muze, now when you're going to fast, then you first need to swallow medicine to reduce secretion of acid. He told me, no, during fasting, he corrected him. During fasting, you're not allowed to take any medicine. I was like, oh. But now, Muze, what are we going to do? Because ideally, your ulcer is very bad, and yet you're a church leader. You must appear as an example. Let's discuss this, because during treatment, the best treatment is when you agree together. A doctor should not dictate. Say, now, my son, I think let me first take this medicine, because I have to be an example to them. Let them, because if I don't fast, then the church will be complaining. But I'm not here to advise you to do faith in the wrong way. The only thing is that during breaking of fasting, first of all, I would recommend before you eat anything, first take warm water. When you have been fasting, the system is all slow. Warm water wakes it up, and you will be okay. Then now you can take anything else. Warm water is very, very excellent. Take warm water before you eat anything. Because even if you put the right food, I think you ever tried, you eat even the right food, but still the stomach does what? So warm food is to wake up the system. So that's what we tell you. Is it okay? Is there anything I've left behind? First, if they test you positive for ulcer, like I was explaining to a gentleman there, that if you are an adult, you have ulcers, save the family. This bacteria, H. pylori, that we test in the hospital, is present in the saliva. You're a mother, you have ulcers. Remember, you share the cups and the plates and the forks and the spoons with your children. Can the children get it? They will get it. That's why it also now appears in young children. That's why when we're learning this, they told us, if you're a doctor and you go to a restaurant, for example, because you have known that there is ulcers and other sicknesses, including hepatitis B and the rest, Wash your hands and eat with your fingers. You are trying to dodge the forks and the what, if you can manage. Otherwise, but to answer your question, it's because of the spread from one member in the family who has it through the saliva to also these others. You get it? That bacteria, among the hard bacteria we fight with in medicine, the hard ones to kill, one is TB. That's why if you have ever seen somebody who has TB, they treat you for 6 to 10 months, isn't it? The bacteria is hard to kill. Oh. The second one is that one that causes ulcer. That's why to kill it, the minimum number of days is 14 days with the drugs, because the guy is hard. If you come that you have been taking drugs for 5 days, 7 days, and you tell me you have been treating ulcers, you have been cooling it. You're not treating it. You get it? That's why people say ulcer doesn't treat. I've been taking these drugs. These people are deceiving us. No, we read you, like I said. When I read you, especially ladies, in fact, when you have a clinic, men don't bring money to the clinic. Money is in injections. Men fear injections naturally. A man will tell, even if you bad love, I will take medicine. I will swallow. And there's no money there. But something called the woman, naturally hates tablets. Musao, you give me an injection. Of course, we also hurry there because that's what brings money there, isn't it? And yet you don't have the injections for ulcers. We only give you for 1, 2, 3 days to just cool it. Then to clear it, you need to go back where? Right now in the whole world, the right treatment for ulcers is swallowing. But if you can't swallow medicine for 1 month, then you go announcing in the whole village, ulcers doesn't heal, you're not doing the right thing. So that's the thing. So the reason why, I think we have understood why even children disease also have, isn't it? Then using that, I want to use this example. There's a baby, the parents took him to Mulago. Of course, every doctor, the last place we send you to in Uganda is Mulago. But you know these days, people, the lines are long, people are tired. They were saying the baby has ulcers. But they are not tested, you know. The baby is ever come. 7-year-old boy. When the baby was brought to me, the father was just passing there to go home. Let's also pass. I'm tired now. Why take my baby to die home? I just looked at the baby with a big stomach. And the baby is even gassing in my office. I asked the muse, when did you last deworm? The muse was like, what do you mean by deworming? I mean medicine for worms. They said, maybe the madam knows. I don't know. Now, at that moment, I wanted to prove to the muse that what I'm talking about is true. I said, muse, I want the baby's poo-poo. I want to send in the lab. Then we called the muse. Muse, you also see by yourself. And he saw the worms, He was like, hey. Because even those worms put wounds where? In the stomach and the system. You get it? The only thing is that you have not seen what some of us have seen. Maybe some of you have ever seen a child who coughs out worms. Have you ever seen somebody coughing out worms? Now imagine what's here. Macrons. A lot. Then others, it can come through the nose and things like that. So that's why I go back to, I mentioned some time ago, let's maintain the deworming protocol. Then some of our husbands, not women, husbands mostly. Because in the community, husbands, as you grow old, you start gassing and people think that's a normal thing for husbands, for men. But they don't deworm. When you don't deworm, you get a lot of gas. That's why I was advising him to deworm. You get a lot of gas and it has to come out. And as it is doing that, you know, it makes kind of, the Baganda call it a chovu. So would call it ekuetete. Then when those people, when you ask them, they tell you that I feel like the whole anus is wet. But the thing is, you need to deworm. You need to do what? Deworming, and dewormers, are they expensive? When I can give you a secret. When you go to the pharmacy to buy on wholesale, in my village, wholesale, when I went to the village, I buy for them. From the village, there is 3,500 a whole packet. Packet having 10 tablets. In Kampala, here, a packet is 5,000. But for us, we can buy meat at home, but just, because if you go to the clinic, they will charge you 1,000 or 500. You can never buy dewormer, but you can buy rice and meat. Are you doing the right thing for the family? You buy the things and eat them. They are good. Because if you don't eat them, I tell you now the problem with us, when you come to the hospital, you see you are smart. At that moment, I will stop thinking that you have worms in the stomach. I will start thinking, making my brain think of hardy things. And yet in reality, what has brought you is just mere worms. You get it? So what do? We continue with our number 2, the most important one. Yes, but I'm not tired. Don't say he's tired. I'm a teacher. I can teach the whole day. I'm okay. You can always ask. Even if you go to number 2, you can come back in case you remember something along the way. So, number 2 is what people call safe days. Safe days. Safe days, most people say it fails for many reasons. First, for you to understand safe days, you need to understand what type of a woman are you. We are not the same. Our bodies are not the same. God, the way God made us, of course, I know a majority of women in the world, they see their periods after 28 days, a majority. But that's a perfect person. No, we are not like that. How we were born, what we grew up eating, and our genes and things like that, we are not like that. So we give a plus or minus 7 days. 28 minus 7 is what? 21. And 28 plus 7 is what? 35, isn't it? Meaning that anywhere between 21 and 35 days is a very normal cycle for a woman. It's very normal. Let me explain. The ones who see their periods once a month, they're the ones who are 28. Because it's not exact 28, some can be 26, 27, 28. But those ones see, if you come to the hospital, ask a question, do you see your periods every month? It means we are trying to evaluate, are you a 28 person or not? If you say, yeah, every month I get it, we are around there, 28, get it? It's okay. Do you see your periods every month? Oh, doctor, sometimes I see 2 times a month. Those are the 21 people. They're so normal in their own way. But I will explain to you where the 21 becomes a problem a little bit. In the community, not in the hospital. Do you see your periods every month? Doctor, for me, when I see this month, next month I don't see. I see the other month. You are 35. But remember, you're so normal, isn't it? Now, the worst, before I go and talk about them, the worst person is a 21. Because the funny thing about those ones of 21, we are here in the church. Pastor's gone out, but somebody will guide me here. Does the Bible allow sleeping with your husband when you're on periods? It's a big crime in the Bible, isn't it? Now, this is a challenge. You are a member in the church, a very strong practicing Christian, and you're 21, you're a 21 woman. The 21 woman is only fertile, meaning that she can only conceive when she's bleeding. She's bleeding, the other cycle has ended, but already she's in danger. Are you seeing how tricky it is? And remember, you're a woman, you're married, the people are giving you pressure, the man's people who want children, who want bicycles, who want itatai. But you're 21. And I've told you you're fertile when you're bleeding. Pastor should come here to guide me here on this. Because this thing, you invited it in church, let's talk about this. Because I will tell you what we do in the hospital, but before we tell you what we do in the hospital, I first want the church to guide me also. And they lied us one time when we were learning in class, being somebody from a religious background. I was like, telling the other professor, now, are we going to heaven? The professor jokingly said, there are 2 people who are not going to heaven. The lawyers and the doctors. I don't know whether he was right. So, but you're going to realize, maybe he was joking, but now like, hey, Pastor, welcome back, and the team. We were discussing about, we had started the second method, the safe days. But before telling women about the safe days, I needed women to understand their cycle, isn't it? That a high percentage of women in the world, they menstruate after every 28 days. And when I talk of those 28 days, but they don't go with the normal calendar. This calendar we buy in the house. The other one is also a calendar of its own. I will even tell you when to start counting it. That's a normal woman, 28. But we are all not the 28 people. That's what I was telling them. because of our genetic makeup, what we fed on when we were growing up, and lots of things like that. So that's why in the hospital we give a plus or minus 7 days. 28 minus 7 days is 21, isn't it? And it's also normal. 28 plus 7 days is 35, meaning that any cycle which is between 21 and 35 is normal. So then I also told them, the ones who are 21, when you come to the hospital, we use questions for getting answers. Do you see your periods? Ah, doctor, I see twice a month. We know you're 21. Do you see your periods once a month? Yeah, every month once. How many times? Once. You're 28 or close to that. Pastor, doctor, sometimes when I get this month, next month I don't get. I get the other month. You are 35. You're also normal. But I was emphasizing on 21 that there is a problem in 21 ladies. Most of them are only fertile when they're bleeding. During bleeding, it means the old cycle is gone. But for them, they are bleeding, but again, they're on danger. And yet the Bible warns that you don't sleep with a woman when she's on period. It's a bigger sin, isn't it? Isn't it a sin? Does it allow sleeping with a woman when she's on her periods?
Okay, the Bible states about that, but of course, that regulation was given to the Israelites for their hygiene.
For their hygiene. I will talk about that also. And it's a good one.
Okay.
I'm happy. Yes.
And there are some regulations that were meant for their medical, because they didn't have medicine experts. So God was their doctor.
Good.
So there are those regulations. So someone needs to examine them properly before you make it a general rule.
Very good. And like I said some time ago, I say that what we do, our godfather in medicine is Moses, was the first doctor, isn't it? So we're still doing things according to that. And I agree with what he's saying. Even as in medical, we know blood is very rich with nutrients. Very, very rich. So why we would ideally discourage sex when you're bleeding? You increase chance of the bacteria growing and you get an infection. You get it? Because of hygiene. He said, even God told them, because of the hygiene, the blood is too rich. In fact, apart from the biblical aspect of eating blood, otherwise in any animal, the best thing to eat would be blood. But the Bible says don't do what? So you don't eat it because of the biblical reason. Otherwise, if the Bible reason was not there, the best thing to eat in an animal would be blood, because it's too rich. Everything it's in blood. You get it? But don't eat blood, please. I'm not encouraging. I also don't eat. I'm a Christian. So, for hygiene reasons, we don't encourage playing sleeping with a woman when she's on her periods. But now somebody comes to your office, she's a 21. What do? Now you advise them. What we tell them, we advise them, one, to maintain hygiene. But they will have to do it even when she's bleeding. Otherwise, this woman will be in a community without producing and abusing her. You are here to fill the toilet. You know our mothers have bad mouth, isn't it? You're here to fill the toilet. I want a grandson, things like that. You get it? So we tell them to maintain utmost hygiene. Then there are those ones who may not understand the statement. Now we tell you, do it regularly. Unfortunately, the way God made a man, I don't know whether men are aware about that. A man cannot play sex 7 days in a week. Can never happen. Can never happen. But, fun enough, some research was done by some professors. You can do with different things, because this research was done in all animals, male animals. But with the same woman, a man can play sex for 7 days. So what do we do to help that? We say, do today, skip tomorrow, do the other day. Even if you skip 2 days, because we're also catering for the man's health. When a man overdoes it, he will become weak and even collapse on the way. They carry him to the hospital, glucose is low, but there is no disease in the body. And that's why we also come to the mothers, please feed your men very well. Okay? Feed, and what's good for our bodies. Museveni the other time spoke about it, but before he spoke about it, I told my friends last year that the gene nuts are dangerous. But not all genus. I'll also talk about that later. But feed our bodies. Our bodies need things that produce sperm. Those are the genus food. Don't give us soup. You know, in artists they say, "Pierre, just you're killing us." No wonder in most communities, men die first and women live longer. You're the one killing us. Give us food that builds our bodies. Give us thick meal. Give us natural foods, the root crops, because in the roots we have there zinc and calcium and other minerals that are good for formation of the sperms and things like that. That's why when we were growing up, boys could say mulondo. But the logic for mulondo is it grows in the soil. The soil is very rich. God made the soil very rich, having a lot of those minerals that are good for our bodies. Not that the mulondo did anything, but the mulondo is rich in what? So you can eat mulondo, you can eat amayuni. Yeah, amayuni, that is amayuni. Amayuni. Oh, okay, anything you dig from the abattoir. Those ones there, they are very good for us men. But not, you may not like them. For us, we need them. Because for you to produce, you need a man to be healthy and fit, isn't it? Not feeding us in these things of, even a man is eating macaron. It is okay, let him eat, but at the end we shall see what type of family he has. Irish, what? Give a man kalo, give him food. We need food. Irish is not food. We need food. Things like that. Yes. So we need food. So so we tell them in the hospital, do it regularly. But of course, say you can't. If you say do it every day, you are killing the man now. The good news is that for us men, the sperms can live for 3 days inside the woman. So even if you do it today and don't do it tomorrow, the sperms of the other day, in case the body releases an egg that other day when you have not done, you can still get it alive. You can still get it alive. So you do it today, the other day you don't do, but feed your man well. Even a bull, when you want, for us in our village, the bulls that they graze them separately. You don't graze with these ones here. They need food such that they can do for you good work tomorrow. Feed us very well. We demand. Feeding us very well is not soup. Give us something thick. Men, porridge. A good woman should be taking porridge. You just say, I love porridge. Children should know that daddy likes porridge in the evening. We need porridge, but reduce sugar. That's why for us, if I tell you the secrets I have in the hospital there, the pastors I have in the hospital, because for us in locally, we love sugar. When a man comes home, you a woman running the blender, making juice. Does a man's body need juice? No sense. No. Give us porridge. And reduce sugar as a man. Tell the madam, don't put that, you don't know my level. Let me put it, then you take it without sugar. And in fact, that's why the families of drunkards, they are happier than the families of Christians. Because the drunkards don't take sugar, isn't it? But for us, Christians, we take sugar, isn't it? That's why if you had, was it in 2001 when some pastor's wife went and cheated with a chapati maker? You know the story. Some years ago, just within Kampala here, because of that. So let's feed very well. Also for us men, let's reduce the sugar intake. Sickness. When you fall sick, after some time, the body gets disorganized, including the hormones, so the cycle can change. Then number 4, have I talked of nutrition? Nutrition is there. So there are many reasons why it can change. So you have to be very mindful of your body. As a woman, the body can change at any time. It is never the same. There are some changes sometimes. Maybe the food, things like that. So after knowing that one, I would want this lecture to be heard by the men the most. Because even if the women pretend to understand, I'm sorry, when they're in danger, even if they have a PhD, no woman understands. They will fight you. Why am I married? Why did I leave our home? Things like that. So the best will be the men to listen to this. And when you listen to it, they can also listen, but you have to be very careful. The most important thing you want to know as a man is the day a lady started her periods. What time, when did you start your periods? Most ladies, why the thing fails a lot, they will tell you when they stopped. We don't want to know when they stopped. Because some women bleed for 3 days, 4 days, 7 days. We don't want to know. You'll understand why when to stop is not important to us. But the day you saw your first period, even the hour is important, because we also have our own biological clocks in the body. If you saw it in the evening, don't say you saw it on Saturday. Saturday is all 24 hours. Because if you saw it in the evening, tomorrow evening is one day. You get it? So the most important thing is the day you see the first blood. That day means two things. It means the other cycle is over. Because if we are to draw a circle, we'll draw it like this. This is because this one I'm drawing for 28. I will also explain to others. This is day number 28, and this is day number 14. You get it? So 28 and 0. So they share the same. 28, the other one is over, and a new one has started. That's the so meaning that for you as a man, as long as you see blood, stop knowing the old one. You just know a new one has started, isn't it? So from that, okay, so not day 0, day 1. From day 1 up to day 8, it is all safe. So if you're a woman who bleeds for 3 days, you're all here. If you bleed for 7 days, it means you only have 1 day free, isn't it? So the mistake they have been making is they count from the day when the period stopped. Then from day 9 up to day 15, this is all danger. I will explain. I'm here to explain. Most ladies ovulate. To ovulate is when the body is releasing the egg. They ovulate on day 14. But just like I said, not all of us have the same bodies. Our bodies are different. There are ladies who ovulate as early as 11 days. You get it? So why is day 9 dangerous? I wrote here that the sperms can live for 3 days. You have played sex today, day 9. You have not done it on day 10. On day 11, your madam's body has released the egg. We want it to get the sperm still alive. It will get it alive. So that's why day 9 as well becomes dangerous. Now, our sperms live for 3 days, but the egg of a woman only lives for a maximum of 24 hours. Anything above 14 hours may not work. Pregnancy may not happen, but let's consider the 24 hours. That's why we go to day 15, such that even if the egg is released on day 14, why day 15 is also dangerous? Because the egg lives for 1 day for women. You understand? Now, day 16, until you see blood again, this is also what? So I want you to do for me math. From day 9 up to day 15, are these not 7 days? Are they not 7 days? Count them. Day 9, 10, 11, 12, 13, 14, 15. There are 7 days. That is the longest time, the hardest life of any family that's trying to avoid pregnancy. And when you're in the hospital and there is domestic violence happening, when you try to analyze, the lady is there. The lady is there. It is the hardest. If you're a traveling man, please travel. If you are there working with your wife all the time, I don't know, because counting 7 days is simple, but that one's like a whole year. That week is too long for a man. I don't know what you're going to do there. The trick of this month may not work the other month. But still, that's why talking to two people, a man can remind, hey, but madam, today is not safe. And yet, the church does not allow condoms. Does the church allow condoms? I don't know. Does it allow? And the church, that I'm sure about it, the church does not allow withdrawal method, because who did that in the Bible and was cast? You see how tricky it becomes? So now, let's discuss here as a team. How can you bypass those 7 days? And for men, before we discuss, my friend, don't ask during that week, hey, madam, remind me, when did the period is? they will be sure they're going to give you a wrong answer. Because at that moment, the brain is not working, the body is talking. I want this. You understand? I want this. So if you ask her to remind you, hey, she will give you a wrong answer such that you assume she's safe. You understand? So as a man, what would you do? Men in the house. Hey, coming back late, the next thing is, so you have another Susan somewhere. Persevere how? First of all, let me assure you, during that week there, the 7 days, dodging the bedroom is a fight at home. You are now dodging me. You have another one, like that. To sleep in church for 7 days. If it works for you, it is okay. But we are discussing it because I can assure you, for us medics, we know even at home, men, you know it. During the 7 days, let me first explain to you. During the 7 days, the hormone that control that danger make your wife more attractive. Even the voice during the 7 days change. The voice is attractive. You see, a woman is like a flower. When the body is communicating, I'm ready. That's when the flower is open, isn't it? She's more beautiful those days. She's warm when you, because actually during the 7 days, the body temperature is above normal by 0.2 to 0.5 degrees. And men know what I mean. When the woman is on danger, you can also know that, for sure, there are times of the month when my madam is really nice. Those are the days. She's singing well. She's giving you food on time. She does not want, so if she's giving you food on time, for her body is communicating, I don't want trouble. Now she has given you food on time and you're dodging her. Don't you think you have a gene somewhere? That's when investigations, all calls will be in the village. Even the workmate who just sent a message yesterday, they will, in the village, the call will be, I have caught him with the gene. It is evidence. I have it. Even when there's no, I have evidence. That is the hardest life in every family, the 7 days. How to manage it? Individually. Even in the hospital, we will tell you, go with condoms. In the church, we don't. Things like that. Even withdrawal is very dangerous. I would also explain that one, but there's no need of explaining it, just against biblical principles. Now, men, it is safe. Because, first of all, this method here, you're not disorganizing the woman. As in, you're not giving her hormones to disorganize her system. She's natural, isn't it? But how can you maintain peace in your family there? How will you manage it? In church? No. I don't know about condoms. Pastor, I didn't tell him about condoms. Do you allow condoms in church? Even condoms, she will throw it away. She will remind you the ring. I have a ring here. Condoms for what? So I don't know what the church can do here. But for my work is only to tell you that the 7 days are dangerous. What do we do? Then here again, here is all safe, isn't it? Unfortunately, remember I've told you that during this, even the body temperature is warmer. Even just hugging her alone is okay. But here, the hormones are that she's cold. Nobody's complaining. Even if a man sleeps facing the other side, there is no problem here at all. There is peace here. The problem is where? Okay, again, for them, the body all again awakens up. Their libido, the appetite again comes towards the menses, which is still what? Safe, isn't it? Towards, just when she's towards getting her periods, again appetite comes in, but it's safe. The problem, I don't know whether I understand what I'm talking about here. Here, there are fights here, whether you're locally, you're not locally, but there is a trouble there. What do we do? What will you do? I've told you I only have one solution for the church. If you're a traveling husband, travel. But she may follow you. You know the women. I also want to know today where you work. You are working in the Gulu. By the time you realize, she has come. Today I also wanted to see where you are working. You see, for them, it is very hard to manage them. Can you pray for 7 days every month? If you can succeed, it is okay for you. It will work for you. That's why what works for somebody may not work for you. So, I don't know. Because this is, otherwise, other methods I want to talk about. Hey, now, this one is not for this guy, isn't it? The 21, you understood that one. That she's only dangerous already again when she's bleeding, isn't it? Now, this cycle works also for these people at the same time. Only that for these people, the ones of 35, the days may extend 17 to 19. That's why it again becomes tricky. That's why we bring in now other factors, like this factor here, the body temperature thing. You can always know today my wife is warmer than before. But remember, the only reasons why the body can change the temperature. Not only this, even sickness like malaria, so we don't know, including flu and the like things like that, if it's viral flu. We can also now add this with what we call the vaginal secretions, because when a woman is on those danger days there, when she's ovulating, the type of vaginal secretion changes. It is it increases a little bit, but more slippery. Because God was wise. God knew somebody is coming, let me clear the road. So the slipperiness for the transport of the spears, you get it? But again, that one is tricky. Also, when a lady has an infection, that's why it becomes very, very hard for you to use that one. The slipperiness of the vaginal secretions is very tricky. But otherwise, this one, the people who have managed that method, right now they have separate families. They are single father, single mother. Because the only way man can manage that one is becoming a very tough man. But trust me, your family will break up. You will break up. For them during that time, there's no logic. There is no reasoning. You're my husband. I want you. So you are there. You don't want me. Of course, that's why you're going to fight. Unless you get a job where they can give you 1 week, you are working a night, but she'll wait for you during daytime. So, Pastor, let's advise. Let's boil our heads. What happens now during those? Because that is safer. The woman's body is not disturbed. No hormones, no nothing. It's just crossing the 7 days. Counseling. But I've told you that however much you counsel, even if I started by saying that even if a woman has a PhD, during that moment, the brain is, forget about the book she has read. The brain is not working. It's the body thinking. The body wants what it wants. So it's not about so that's why counseling 2 is good. Then the man, okay, another thing to simplify it, as a man, draw a thing, let it be in the bedroom. When she's disturbing, he says, hey, madam, if I was going to check, today is day number what? For you have where you have marked, isn't it? You have marked somewhere the other day started on this day. Then, where are we now? Madam, you see, now they can become ashamed and say, okay, let's leave it. But don't ask. And as a man, be the one buying pads at home. Why do you want to buy pads? Because you want to monitor what? You want to monitor this. A lady should not buy pads with her money, because now you will be lied. Buy pads. Say, hey, madam, the pads are not going. I have not yet reached. Okay. And never buy many boxes. You need to monitor monthly. We want it to get over. That's one simple way of managing it, isn't it? And when she tells you, I started yesterday, because when she's still bleeding, she tells the truth. She tells the truth. When you mark it. When you mark it, be with it here. When she's disturbing, you pretend. If I was going to check, where are we now? On day 9. Day 9 is not safe for us. No. Then you can be safer there. There, they cannot accuse you of a gene somewhere. No. But still, I don't know whether you can succeed to cross that bridge is the longest. That's about safe days. It's just very simple like that, but tricky, yes. I think she came late, but still I can repeat that. When you have, because what controls all the woman's system, the reproductive system, are the hormones that are released from the brain. So there are people who have, just like we know machines can disturb in the church, isn't it? For very many reasons. Your biology, I want to use the word biology, or the system. your system can get disturbed, not operate to the acid. For the sperms to be, now if acid is stronger and you're producing little the people who are like that, she goes where she produces also, then them alone, then the coral comes in, maybe you are bewitched, but in real, unfortunately, I don't know. In the hospital, we don't believe in witchcraft, but maybe it happens, but that's a talk for another day. So you need hormonal profile, you get it? And it takes a longer period. Only that I have, in our village, some of you may be knowing the story I'm going to tell here. There is a man in our village, he's a pastor in some church. When he was growing up with other boys, he fell from the tree and his testicles got damaged when they were growing up. So he married. And the people who grew up with him knew that, that one got an accident in that. I think you already know where the Bazungus came from, isn't it? So that one is also there. So we need to treat two people, okay? Treat two people. But now if that like that one whose testicles were totally damaged, we only counsel you to accept the fate, accept the life the way it is. But we need to treat two people. So is that something that we need to talk about this? This one, my role here is only to guide you. Only that for us in the hospital, we give you this and a backup. Backup would be condoms and etc. But in church, we don't have access to condoms, so the members of the church can now, that's why one, remember it requires commitment, hard work, faithfulness. Let's be faithful to our target. If we're not doing anything, isn't it? That's the faithfulness. Then two people, teamwork. Of course, these methods are good because they improve communication. Because I also know families, most people don't communicate with their wives. They pretend in church, but in reality, when they go home, they don't talk. So that one can also improve communication. If you can communicate with your wife in a hard situation, madam, we're not doing today because you're need, it also becomes good because not all women are bad. There are those who really are good. You know, they listen. They can even remain a man. No, today, for sure, I'm in danger. We are not doing it. So for hospital, it will not be hard for us because we give backup. For church, the backup is not biblical. So now because my work is to give you the information, then you devise means of protecting yourself. Then the other one already, the number 3 I've already mentioned about it. This one, monitoring the vaginal secretion, but that one is too risky. Like I've already told you, we'll look at the nature of the vaginal secretion, but also infections, which are common in ladies. And in fact, for us in the hospital, we know, even here, if I'm to get 10 ladies at random, and I go and test their urine, I will get 8 sick, having infection. But like I said before, for ladies, infection can be asymptomatic for as long as 8 months. Others can show up very fast, but can be there for 8 months, but you don't know that you have it. You have it. So that one, the number 3 is tricky. So when it comes to natural methods are limited. One is that one with its own challenges. The advantages are there. The woman is normal, no hormones, the body, things like that. It's okay. But challenges, how to cross the bridge. This one, 6 months, is okay. But you may get very fertile ladies like that. It becomes tricky in them. It will not work again. You get it? Then also, about this one, some ladies may go to their danger even before they see their first period. That's why you hear some women saying, for my conceived before I saw the first period. It becomes all tricky. That's why natural ones are few. They are few, but they are difficult. In a hospital, we do the other ones, backup, things like that. But also, it would be very sad for me to leave here without mentioning about it, because indeed, when I was doing my course, my research was on family planning. I did it in Mbale Regional Referral Hospital. And one of the things in the research, it was to dispel the myth, these false beliefs, and including religions. It was my recommendation, but again, today I'm here in the church, now I'm failing to dispel because I want to do what the church is doing. Otherwise, in the reality, they also have their own advantages and the disadvantages. Now, about the other ones, prolonged use of family planning increases your chance of getting the other hormone of cancer. Prolonged is 10 years and above. So, Because, Pastor, I have to tell you the truth. Some people sit here and they lie, but when they come to the hospital, they do otherwise. They may even choose what we don't want to talk about here. They do what they choose. Even others are having a hormonal, but they keep quiet here. Only that, to me as a medic, I don't want to be on record saying the others are so bad. But the only thing is, let me just mention about this one. Others say when you go for family planning, you become tiny. When you go to family planning, you gain weight. I can explain all those ones. Women are different, like I said. Women are different. Our bodies are different. Because those are hormones. Some women, when you take those hormones, they affect appetite hormones for food. When the appetite for food is cut down, you become tiny. Some women, because in the brain, there are two hormones released. I will not mention their names. We're not here for exams. One is for appetite, eating, isn't it? One is for you to feel satisfied. So for some women who gain weight, that hormone goes and affects this one, the hormone that tells you now I'm satisfied. So you eat and eat and eat. And of course when you eat and eat, won't you become fat? You become fat, isn't it? So that's why some women, when they go for family, they gain weight. The others who lose weight is because some of the hormones can affect what? Can affect appetite. They lose weight and they lose appetite. Then there are those ones who overbleed when they go for those ones there. Because the other hormones there, they go to the brain. Let me assume the brain is there. The brain has to communicate to this, the uterus. The brain has to communicate to the ovaries, to where the eggs are produced from, isn't it? So those hormones, some of them cut this communication. The ovaries don't produce the eggs. Then some of them, they make this one not to prepare to form like where the baby is coming to feed from, a layer. That's the layer that comes out when you are menstruating. So that's what happens. So for some ladies, this layer can keep on it doesn't become thick. That's why when they're on family planning, they say, I bleed now, but the bleeding is little. So the layer keeps on forming small and keeps on shedding constantly. Then for some who become normal, the communication is cut totally and nothing is formed here and they don't see periods. Then the ladies say, now if I don't see periods, where does that blood go? When there is no blood, nothing comes out. Because this layer can only form when the communication has reached here, isn't it? If the communication is not there, how can this form? So if you don't see blood coming out, don't say it was accumulating. Accumulating from where? It doesn't accumulate. Then for others, then of course this communication here, as long as you're in family planning. Then there are others even who stop family planning and still the periods are not coming back. Because the communication can get cut and the body gets used to no communication, even if you have stopped family planning. But as time goes on, when you feed well, feeding well is eating a lot of greens and plant materials. The communication may be opened again, then again they come back. That's what happens. So, then also the other one. I want to go back to the other one. The reason why we give the pills, some pills, they do the family planning, but others save you from other issues. Now the girl probably, like I have ever given a girl also family planning pills. But that girl, what I did, I saw her. She was ever in a class. With a rough skin, I could know she's anemic. Of course, when you lose a lot of blood, you become anemic. What I did, I told her, come tomorrow with your father. I had to explain the thing to the father. Then we met in the hospital. In the hospital, I'm not a teacher. Now, the father understood, and we had to give the girl those pills to stabilize her body. Because that girl, if we didn't stabilize, she would die because she was losing blood. 6 months bleeding non-stop. So meaning that she was losing blood, isn't it? So there is a time when we give. If the doctor, like for us in this church, if the doctor gives you the pills for family planning, you don't take it. It's your choice, isn't it? But if the doctor is giving you for other reasons, some pills, you take them for that reason, okay? Because it is also good. Otherwise, we don't want to lose you. Like Ladies who are very hairy. Hey, by the way, before I forget it, women and men, we have the same type of hormones. There are hormones, a man and a woman, we all have a hormone called testosterone, don't mind of the name, and estrogen. Only that one in men should be more than the other. One in women must be more than what? The other. That's why for any imbalance, sometimes you get men behaving like women. I think I've seen them in the community, isn't it? Because now, for you as a man, for the men are supposed to be up. And when they're up, you have beards, your voice is big, things like that. Even this thing is bigger. You've seen like boys in the village, eh? The Adam's up, isn't it? But you can get the man speaking like a woman. No, don't worry. It means for the women is what? Is a little bit up. A man, when we were in the medical class, they told us that a man God created is supposed to be big up and small down. That's the normal man God created. Then the woman God created is small up and big down. I guess you know what I'm talking about. Imagine a man with also cabina. Is that a normal man? Okay, but we are not here to judge, isn't it? We are not here to judge. But all this comes because of these changes in the hormones. Otherwise, if you're a true man, you must be bushy as a man because the hormone dictates, okay? And those hormones, fun enough, they're produced from the testicles and the ovaries. You get it? Now, if you're a woman who has more hormones of a man, we need to balance you. So we need you to go back to become a woman. When you have more hormones for men when you're a woman, even you don't find men attractive. You feel like they are your bad days. We are men. You have seen those, even the community, even they like men's companies. They like moving the men. They see them as a fellow what? Fellow men. And now how even getting married is hard for that one. So we need to go take her to become a woman by giving some of those hormones, because in the pills there are hormones, isn't it? But we choose. You don't just give anyhow. We choose. Then for the men, for the men in Africa, we don't do that. But that's the science the homosexuals were doing. Homosexuals were giving women hormones to make the others for men to go up and start behaving like a woman. You get it? But in the hospital, we want to do it this one for treating women, okay? For treating women. Then another thing I want to talk about it is what? I forget when I was talking, I was remembering, but I'll stop talking. I've forgotten. It was about the hormone still. So the thing is, understand why. Ask your doctor, why are you giving me this? Because there are doctors who write when they're quiet. By the time you go to the pharmacy, they have given you family planning hormones. Then you come and say, but this doctor, why was he giving me? He should tell you the reason that I'm giving you this one because I'm trying to correct the other problem. You get it? Like ladies who are very hairy. The male hormones make a man hairy. Now, if you also get a woman who's hairy, just know she has more male hormones. Even appetite for sex is not there. It's not there. I need to want you to be a woman. A woman must be smooth. You get it? You get a woman with a deep voice. She has more of the male hormones. We need you to go back and become a woman. You get it? So we give the things for different reasons, because in the church and the hospital, we mind over the family, the stability of the family. If the family is stable, it's okay. For example, if the family has children, unless you're a total orphan, but if you get, as a woman, you get married to a family and you fail to produce, I don't think you can have peace in that family. So we need to stabilize you. And in that case, we need men to support the women. Okay? So when it comes to family planning, the pills for family, you have your choice to say no or yes. But if it is for correcting an issue, like when I started, remember I started with these ladies who have beards, isn't it? For me, I don't know what pastor would say, but I would kindly request pastor, in that case, the pills are not for family, but to stabilize her, isn't it? Because if you don't stabilize her, the other swollen things, they become cancerous, and she gets cancer, and she will die, isn't it? We also want her to produce. We give, but the good news is this. When we are stabilizing a woman, we don't give for a long time. We give you for 3 months, we go and check. Because in most cases, it can get corrected in 3 months. If that one refuses, we go to stage 2. We may leave those ones, go to the injectable ones. You get it? But it is part of a correction. Like one time I was treating my brother for some disease, but on phone. He called me after coming back from the hospital. After coming, he told me, asked him, what have they given you? That mere flagell. I was like, I wish you knew that drug. You know, some people ignore it. I think people have said the flagell is for the stomach. No, it's not only the stomach. We use it for many things. So that's why you can get one medicine, but we can use it for different other purposes. Now, Pastor, I want to warn you such that people don't come here lying during testimony times. People can come to church, and I've seen it a lot in different churches. I was struggling looking for babies. Then God has paid me twice. I have 2 or 3. Pastor, those are our customers. Because some of the drugs we give them, the side effect is they make the body to produce many eggs at the same time, isn't it? So for you, we keep quiet. That's why for me sometimes when I'm in church, this tricky, when you hear people talking and you know this one's lying to the congregation, you keep quiet. We know, isn't it? I think you have heard about it. I was looking for a baby for many years. Looking for a baby. God paid me 2. But they will never mention that I went to the hospital. They don't. But the most important thing is for us, we are after the stability of the what? Of the family. That's why you can't come here and say, no, Jane, you're deceiving. Were you not my client? As long as the family is stable, we okay. Are we together? Now, family planning about this natural ones, they are really few and they are tricky as you have seen them, isn't it? But requires a lot of determination, especially from the man. Moreover, the Bible says the man is the head of the family. So you need to hold it with your hands and plan every day you're planning. What this month may not work next month. If you went to Gulu this month, I don't know about next month, whether you go to Gulu again also, things like that. But for me, there are some things I feel like I should not live here without mentioning. Because when you talk of a lady, not everybody is interested in this because there are ladies who are no longer interested in producing. But talking about the whole healthy life as a lady. Ladies have problems. That's why you don't get any doctor saying, I'm specializing to treat men. Which customers are you going to get? But you hear everywhere gynecologists. Ladies have problems. Please, I want to advise ladies that, 1, every 3 years, go and screen yourself for cervical cancer. If they say today, it's not there, please go back after 3 years, screen. If you have been watching news, last week there was news on NBS that cervical cancer has increased in massacre and disturbing doctors. Not only when they say it has increased, not only massacre, and even in villages, there's a lot of cancer. In fact, these days the cancer is becoming over like what? You don't take a week before hearing cancer. And some of the things are preventable by us. Like, let me first finish that point. When you test today, you're not there. And the test is very simple, not even painful. It's not painful at all. Go and repeat the test after 3 years. 2, you're a girl. I'm not here to advise bad manners, but you're a girl. For your own body, not for the church, not for the family. What are you doing at 30 years not producing? Because when you come to the hospital, how old are you? 30 years. Do you have any child? No. Already no. But you don't say because you get scared. We know we are dealing with a dangerous person. This one can easily get cancer of the breast, and things like that. What are you doing? And for the men, I don't know whether I should mention this point here because I may be attacking some women. For the men, medically, a woman gives healthier children. They say between 18 to 24. Men, women lie a lot. One of the reasons why some methods are becoming very hard for us in the hospital and the story spreads in the community in the wrong way. Ladies lie a lot. There are methods of family planning, for example, family planning, that work for 35 and above. You come to the hospital, you say you're 30. We give you the one that's fit for 30. The thing disturbs you, then you go telling everybody everywhere, these things are bad. That you need to tell the truth, but of course they can't tell. there are ladies who lie a lot. There are methods that are good for, but some ladies are 18, but when they're 17, but they fear the Lord does not allow them to get married. They say, instead of 17, I am 19. Things like that. So we need to tell the truth. So some things happen there. It's like when you're in the kitchen. Okay, for us in the hospital, what you tell us, what we believe. So whatever, whether you have lied us, you have not lied us, it is upon you, you get it. So please embrace checkups. Bazungu, for us in Africa now, they say, now our life expectancy in Uganda is around, and I've not checked the current one, but there is a time when they say when a man reaches 60, he can now die anytime. Women, 65. In America, men live for 80 years, women live for 85. Things like that, you get it? So why, and yet we're eating the best foods. Why? We only go to the hospital as the last resort. Anyway, for us in the hospital, we believe that you come to this world, you are born in the hospital, and you die where? In the hospital. So it is okay. Whoever comes to the hospital, not that you have come to heal. Sometimes we help you to go well. We don't want you to die with the pain. We want you to die peacefully. Don't delay. Then after delaying, when the problem has become worse, you run there. It's not that we shall not do our best, but we shall really see for this and where it has reached. Now what we do, there's what we call palliative care. Palliative care is taking care of the people who are sick and there is no hope of recovering, because we want them, we counsel the family to accept, to plan. You're on a bed, but you tell the family, prepare the home. Because anytime this one is going to do what? This one should not die and the home is disorganized. Then 2, we now tell the family, bring pastors, bring the Muslim people or the sheikhs, pray for this person to prepare your way where. So when you come there, it's not that whatever you see us doing, we're injecting you, now you're going to get better. So the best thing is the prevention. Go to the hospital. Even when I have my uncle, he stays somewhere in Bweyogerere there. My uncle is tall and huge. He's a scientist. I used to tell uncle, the books I read, they say you can never be fat and healthy. Uncle was like, he's a pastor, what, Toto? My Bible was there. I was like, Uncle, no, don't worry. I told him, he's a teacher and lecturer. Last holiday, I told him, before the term starts, Uncle, have discovered in Ibombo. That's why the soldiers beat us a lot. They have good service in Ibombo, better than Mulago. If you go to Bombo, for those who have gone, you know what I'm talking about. I told Uncle, let's go to Bombo. There are machines there. Museveni has bought for his soldiers. Went there, testing. Hey, did we come back the way we were happy? One part of the heart is starting to die. But we are not feeling anything. Things are symptomatic. Are you seeing? By the time they show up when they're in another stage that you can't save the person. So let's do checkups. You can just pass anywhere. Hey, Musawa, first check also my blood pressure. They check. They may get you when it is threatening. Hey, Musawa, how are you today? I have some man of mine, but I don't know. I want to let me check my weight, check my height, things like that. Let's check our bodies. Then, whenever you have a problem, don't postpone it, treat it. Ladies, treat infections. One of the causes of death, these cancers, untreated infections. 2, poorly treated. They give you medicine for 14 days, you take for 3 days, you say, I'm tired. You see, poorly treated. By the time you realize you are sleeping in the church, crying, God is there, can heal us, but let's do prevention. Knowledge is the power, isn't it? Hey, let's go for checkups. For a lady, 2 to 3 months, go there at the hospital and say, let me first check my urine. Yes. Some of us who are gifted with money, a carpenter's mistake is a design, isn't it? If you have money, you as a lady, what is a sitting toilet doing in your house? A lady is not supposed to use a sitting toilet. Because when you're urinating, the urine goes and comes back, isn't it? Hey, getting the other bacteria and you are whatever with infections, you should use a squatting toilet. Hey, of course these days design, you want to sit. I don't even know if the poo-poo can all come out. But for men, when we are making these things for our wives, if you have money, keep away from the sitting toilet. Let it be like, I'm happy for the one for the church. It's for squatting, isn't it? Hey, unless maybe you have somebody who is sick and is broken, you can now talk about that. You're sitting one. But if you are healthy and you're a woman, what's your sit? Even men, by the way, you can sit in the toilet. The infection that attacks a woman can also attack your anus. So what is it? Why would you want a sitting toilet? Don't copy. Others are doing it. Don't do that. Others are doing it. So sugar, let's try to moderate it as Christians. Then our health, women disease is a new trend of dressing book, bikers and whatever it is. Keep our nails as a woman. For men may not be, but a woman, you need to cut your nails 2 times a week because this can give you serious infections. Then check your weight as a woman. Also women, you have ever heard on social media we say, for us doctors, we know when we say a lady with a big cabina, we know that the ambassadors, the general secretaries, the what of infections. Why? These bacteria that attack women, some of them, they grow when there is little air reaching you down. So when you are too fat, obviously even you are squeezing it, how much air is reaching down. That's why you wonder why our mothers of long ago, they never used to talk about infections. Because they could only put on the panties when they know we are about to get their periods. The rest of the days, and by the women, I'm not making fun. Now, if you're mature and you know that your periods are regular, so if you want to keep away from infections, keep away from panties sometimes. Allow the body to breathe. Buy these big clothes. How they call them? Markets. How they call them? These big clothes of women. And there's a way they used to call them when we were young. About markets. These big skirts. Hey, whatever it is, allow the body to breathe. And you will not, when others are talking of infections, for you not talking of with them, allow the body to breathe. When a doctor sees a girl wearing a tight jean, you'll be like, either that money will come to me or go to my friend. But there is money there. When a doctor sees a lady with long nails, we smile. Either the money is coming to me or to my friend that I don't know. But there is money there. Infection. So there's something that makes us happy. These days, that very friend, uncle of mine is a pastor. Uncle used to ask me, when we go to church, we pray for the sick. Let me ask you, do you also close the eyes to pray for the sick? I laughed and I never gave uncle my answer. Because doctors, if you don't have customers, our customers are the sick people. So that's why it is tricky. When you have the ones you love, you take them the secret, isn't it? The ones you don't love, you keep quiet. You also want money home. You get it? Hey, like during COVID is bad. COVID brought me money. After COVID, people learned self-medication. Do you know every hospital right now is suffering? These days, people, they go, come test, then they call a friend, Musao, they have got me with malaria. What do I, then they, so hospital, you go anywhere. Doctors are seated in the veranda, they are suffering, isn't it? Because now every family has a doctor. Doctor, they got me with malaria. What do I do? You go and buy cotton. That one becomes okay. So the other one is still banned. So your own, you advise them. But the one who is not your own, when you meet the person, you keep quiet. Like when I get people eating chicken on the streets, I'm like, either the money is mine or for somebody else. For people who have ever reared chicken, anybody who has ever kept chicken here, farming chicken, there is what we call fowl typhoid, the typhoid for the chicken. And that typhoid also attacks us men. That's why during those days before COVID, when the streets were busy making money in the hospital, what was making us get money was the typhoid. You see, when you go to a place, you get people are wearing cannulas. Just know the doctor around that place is having money. He's having money. But these days, people are poor. No chicken on the streets. Even the typhoid has reduced, isn't it? Which is very bad for us. See? But when I hear, in fact, when I pass here and I see people are buying chicken, I have to plan that, I need to open a clinic around here. That's what we do. So, the ones you love, you tell the secrets. The ones you don't, okay, it's not that you don't love, but you don't know them, you keep quiet. You get it? So, when you talk of dressing, women dress well, drink water, because also those good, that's why they tell you, ladies, don't wash down with soap. Soap kills the good bacteria. Not all bacteria is bad. There is a good one. The good one protects you. But when it overgrows, it attacks you. The good bacteria, when it goes out of the body and comes back, it attacks you. That's why even the sitting toilets are bad. The good bacteria comes out. When you urinate, comes back as an enemy. That's why the sitting toilets are not too good altogether. So take care of yourselves. For sure, it is, and it's very painful. What we go through is very painful. And it's worse when you connect with the patient. You treat this patient, and you have every day you come and treat here. Now you connect. When that person dies, you get more affected than the owners of the patient. You'll be like, I will never see this again. The pastor says we shall go to heaven. How about if I go to hell? This one goes to heaven. It means still we shall never meet again. So you see that. So we connect, and most of you think doctors don't cry. You don't see tears here, but we get disturbed. When I was treating the other Muse, I was telling you that of cancer. The Muse annoyed me. I told him, a retired head teacher. But then there's another one. Pastor, I'm happy Pastor one time preached about it here, energy drinks, about being satanic and the symbols. But on the medical side, I don't want to talk about the satanic thing. I always told people that 5 years from now, you will again hear on TV when they're saying the government will come out to ban energy drinks, because the way those things are killing people. But they don't know. I work with somebody who takes 3 in a day. I used to warn him, he was big-headed. He started collapsing at work. What was making him collapse? High blood pressure. Those things, they narrow your blood vessels. Then the heart starts struggling, pumping blood through healthy. And the first doctors at home cook well. Some of you cook food with a lot of salt. Now the family has got used to your too much healthy. And the first doctors at home cook well. Some of you cook food with a lot of salt. Now the family has got used to your too much salt. Too much salt in the heart is the same as a lorukende. Do you know lorukende? The other local waragi. Somebody comes to the hospital, the pressure is high. Do you drink? No, I'm a pastor. Then he said, no, because we are trained not to trust patients. No, but by the time he realized there is a pastor, but the problem is in his table there is this choco, this salt of table salt. Then they go ahead and lie. Hey, I'm going to use the Himalayan salt. Salt is salt. Whether from Kenya, from Uganda, from Himalaya, salt is it. The more you reduce salt, the good for our heart. Ladies, it's you. And you don't want to be commented that the food is having too much salt. Okay, now you can eat the good one somewhere. Domestic violence comes in. Please learn how to cook. For us, we fear to comment. Otherwise, we know where the food is nice. There is a restaurant where the food is nice, only that we fear to dodge eating also food. So we die slowly, isn't it? So salt, be careful with salt. Then also, men, we order our families. Now, then there is also this one. As an adult person, what's the blue band doing on your table? To make the bad salt. And that bad salt, it appears around the liver. And that's the hardest fat, the bad fat, the hardest fat to remove from the body. And it kills like poison. Hey, then you die tomorrow, poison, they say you ate from the other side. I don't like that thing of, in fact, when you go to the village, I'm not saying poison is not there. It's there, but people lie a lot. They kill themselves, then they go and poison. And yet the feeding is wrong, isn't it? Hey. Talking about oil, G-nuts Museveni talked about. You know, G-nuts is not bad. But again, I don't want to writing on. That because of the storage. Actually, what Museveni, I was very happy when Museveni talked about it. In only that Museveni did not teach people. Oh, she doesn't know. Oh, sorry. Aha. And even when you're eating it, sometimes it's bitter. Now, the chemicals that make it to form that is what we call aflatoxins. I guess he knows them better, isn't it? That's why, and those things grow on our food when post-harvesting, after harvesting and during the drying process and the storing process. That's why, talking about Uganda and Kenya, our maize from Uganda, they don't allow it in Kenya because of those chemicals. There is some amount allowed beyond that. By the way, it causes cancer, sure deal, terribly. That's why when you look at the website, you'll realize that the cancer of the throat and the liver is common in West Nile, because you see, when you move in Kampala, yeah, which people pack Guinness? West Nile, isn't it? We have the same culture with Teso, Northern and Teso, because of that. For us, that Guinness which is bad, they sort it in the village, they say, this one I'll use it for my sauce. Then you sell the good one. You get it? Now, when Museveni talked about that thing, people were like, what is Museveni talking about? There were science there, but he did not. The only thing, he's supposed to bring scientists to teach people how to dry nuts. Like there are some boys from Mbale, they are studying that Elgon Polytechnic. They have formed their thing for drying, the solar dryer, things like that. No, those things should be taught to people. Now, not only that nut, which is Leroy, that one, even this nut in the shop, you see this one, we buy it, isn't it? Now, there are those things that are in the air, the things that grow in the nut. They are in the air, the spores. You leave the thing open, they drop there, they will grow, but your eye doesn't see. In reality, if you are to look there with a machine, it looks like the spoiled bread, but you can't see, isn't it? Go and cook your food at home. So some of those things, they are stable in heat, meaning that even if you overboil it, they hardly die. You serve yourself, then you eat. Tomorrow you get this one, then you start remembering like my friend was telling me, that in his village, there is a woman who's feared to give people poison. One time, but he used to move with the son of that woman. One time they went, they served them milk, but the woman had put that jinga. He had never taken jinga. When he was taking jinga, first of all, he was fearing, I'm here with my friend, I can't dodge this tea. But now, and when they were bringing, he said, maybe they had marked. He tried taking jinga, the thing started to say, problems, today I'm dead. He said he refused to move away from there because he wanted he was saying that he was planning either to fight or to force somebody to take the what? The tea. And he stopped, he said, telling the friend, you know what, eaten from there. I said, I'm okay, let them take. But he was surprised. They got the tea and distributed to the kids, and the kids took it. That's when he got the peace. But still he went to home. Why? Things like that. So some things happen in the community because of lack of knowledge. Then we start blaming each other, cancer, things like that. Get it? So ladies, as men support our ladies, let's buy for them enough panties for hygiene down there, isn't it? All men should go back home, train our families to use water in the toilet, buy a 5-liter jerrycan in the toilet, and take initiative to always fill it, isn't it? Our ladies should learn to use water. Yes?
On water, of course, most the Christians, they don't often not use the water as you had mentioned, but just want to emphasize that water for us ladies and also men, they may use it for cleaning themselves, but again, when you go to the toilet, some may not leave the toilet clean or the latrine, what they've used, and then they go away. Then another one also comes, finds the latrine or the toilet dirty, and they just squat. So I just wanted to emphasize, and I want you to emphasize that point.
Very good. Like I said, when the good bacteria leaves your body and comes back as an enemy, we can't have the same behavior in the community. Others use the toilet badly, but for you, lady, before you squat there, when you go with a 5-liter jerrycan, first splash some water on top, isn't it? And besides, you can become radical and always put a detergent in that water, like some Omo, splash. The other remaining water you can use for washing yourself. You're also protecting yourself, isn't it? You don't use it the way it is. You have got it wet, you just also go and squat there. Then water, drinking water. The more you drink water, the better of the good bacteria. I mentioned that when the good bacteria overgrows, it becomes an enemy. So the more you urinate, you're also flushing them out, reducing them, isn't it? Don't get shy to say, people are going to say, I am over-urinating. It's good, but of course, sometimes you may over-urinate because you have an infection. Because when you have an infection, the infection goes and disturbs your brakes, the natural brakes that hold the urine. That's why when a woman has an infection, she finds it very hard to control the urine. But if you know you're okay, please drink water. And ladies don't want to drink water. They will ask you, doctor, how about when I drink juice? Then you ask them, what's the difference between juice and water? The spelling is number one. Are they the same? Water is life. Even right from primary, your teachers tell you water is life. Drink water. And a minimum in a day, 3 liters. Whether you're thirsty, whether you're not thirsty, drink 3 liters of water. And you'll be healthy. You'll even realize your body is... last week I went home. And the other lady brought for me the results of the urine. Yes, she had an infection, but at that moment, my target was not infection. I saw signs of kidneys getting disturbed. And she's a young lady, she's around 28, 29. I asked her, what did the doctors tell you from there? They shouted at me. I told her, you mean I've not been shouting at you? Drink water. Because the water, one, these days we also have kidney failure. It's like you're washing your kidneys. Drink water, urinate to wash the kidneys. 3 liters, if you're an adult, 3 liters. Is 3 liters too much in 24 hours? Don't drink because you're thirsty. Some people can train themselves that the whole week they're not drinking water. The body will get used to it. But it's not safe for you. Drink water, especially when you're a lady. Okay, everybody, drink water. 3 liters, is it too much? Not too much at all. I may not finish everything today.
If we have irregular, you said sometimes they're not regular, and we are supposed to follow that. How can they be made regular? What can we do in that case?
I was supposed to announce a warning that one is for stable periods. Stable periods are the regular ones. If you are irregular, my friend, that's not safe for you. That's why when you look at the natural family methods, the safe ones are very limited. With a lot of the advantages are there. They're not expensive because you don't spend any money, you don't disturb the body. But for them to be good, to stand, it's very tricky. When you have irregular ones, this one doesn't become very effective for you. It can still work, but not very effective. Because by the time you realize, you may think we are counting days, the body has shut down, it is in sleeping mode. By the time it's waking up, you continue to count. So you think you are in the other last safe days, now the body is now in danger zone, you get it? So, the what? They can be made stable. First of all, to make you stable, if you have been stable, because we ask you, how were they before? So first we query you, maybe you have something stressing, have you traveled recently? If you travel recently, we shall tell you, no, don't worry, they will stabilize. Then your nutrition, eat a lot of plant materials, you get it? Drink a lot of water, balance the body. So then we also look at the possibility of sickness hiding in your body, because also when the body is sick, it can't remain functioning normally. So we first look at that before we, when we try all that feeding, we give you some months, things like that, when they refuse. But if you give them regularly, we may save you from the hormones. But if the irregularity is too big, we may bring the other hormones to you to stabilize you after doing the other tests, the hormonal profile things. You get it? And then before I forget, another reason why the other hormonal things are dangerous. I told you number one is the lies of ladies. They don't tell the exact age. And then two, they are according to the different methods. There is a method we push down. When we push it down, it increases your chances of getting infections. In fact, you can have infections twice a month even. Because our bodies, when something foreign is inside your body, it brings infections. And the body also starts fighting it. That's why those people use the one down. We need you to check your urine almost every month for infection, and you'll be taking medicine in case you are sick. Because if you don't give the medicine, the reproductive system will get sick and other cancers come in. Then there is this one put here. Women say, it disappears, goes to the heart. Sometimes we give, like I told you, there are some ladies who give you when you're tiny. Along the way, you gain weight. Because we put it between the muscles. So the muscles cover it. So when you touch, you don't feel it. But it's there because when we're moving, you get it there. You don't get it in the heart. Then this one still we push down. Depending. Let me first warn. Though some ladies may lie the pastor, they go to hospital, they do another thing. When you go for hormonal methods, Don't choose a method that goes for many years. This is just my own. Like you go for 5 years at once. The body may, because remember the target of the hormones is to disorganize you. The body may get permanently disorganized. Give your body 1 year, allow it to stabilize, give a break, go back. The other one may extend, of course, depending on the pushing. Sometimes can push and goes past the uterus, but that's a rare thing, things like that. So every method, you have seen even the natural, though it keeps you normal, but it has its own challenges, isn't it? That's why you need to combine many, very many methods to achieve success in a family, okay? But most importantly, women, be supportive with your husbands, and husbands support the women. Let's avoid domestic violence, because right now, on top of fighting for HIV, they have added that domestic violence. Let's avoid domestic violence when you're trying to avoid some problems. And right now in Uganda, we know the biggest district with the domestic violence is Tororo. The Tororo women are beating the men. In fact, in Tororo, it's not the men beating the women. It's the women beating the... And when you go to police to report, the police will not believe my wife has beaten me. They will laugh at you. So men don't report. They don't report. So the pastor... Sessions like this are good. Counseling, joint counseling is a good one, because sometimes what they do is they separate women from men. Now like this one, what I'm talking about here, tomorrow when a man is doing it, others ignore. But joint things such that you can understand why are we doing this in a family. As a man, when your woman is cooking food with a lot of oil, I don't know whether you go to heaven, but you lie, say, for me, oil makes me feel bad, like I want to vomit. Just because if you refuse her food all the time, she will be like, why is it that before you were enjoying, why is it that these days you are changing? You have got somebody who cooks for you better, isn't it? So you just say, these days I have realized this thing takes me badly. You need to do some lies somewhere, but carefully. Any question?
For me, doctor, mine is like, it is all contrary to the safe days. Mine, it has taken long when I follow the 28 to 35 days. You are saying from that first day to the 8th day. I mean to the 8th day? Yeah. To the 8th day. Yes. You are saying those are safe days. For me, they are not safe days, because I've ever done it. In my own circle, it is only the first 4 days. And the 5th day, I can try the 5th day.
From the first time you see blood?
Yes. Then I finish the 4 days. Then I count 4 more days on top of the 4 I've finished. The 5th day, I shouldn't step midnight.
Because the 50th day when you do the math, hasn't she entered day 9? Because she's saying the first 4 days.
When I see. Yes.
So when you add more 4, 5 days, you have entered day 9. That's why I was like, you can't from the first time you see blood.
You see now, when you count, you say the first day you see the blood.
That's the day we consider.
You consider. Yes.
Don't care when you stop bleeding.
Yes. But now, for me, when I go, even if I reach up to that date you are saying, the last day here, up to the 9th day, they are all, actually mine is, it's a disorganized thing. Because even I reached the extent of my sample to be taken abroad. Yes, from Zambia. That was Dr. Payas. Whereby he advised me to use only the moon bead. If not, I should use it, the coil, the one they insert. And I feared to use it. Because you hear from people, that is it. And is it keep on checking on that thread, whether it's there or what?
Even if the thread cuts off, you can still pull it out. Because that thread will keep for long.
Yes.
The purpose of the thread is only for pulling it out.
Yes.
So when it keeps for long, the thread will get cut and disappears. But doesn't mean that the thing has disappeared. You can still get it.
Now, from that time, I resumed after 1 week. The second week, I'm bleeding. After 1 week, after the 2 weeks bleeding, 1 week, another week I'm bleeding. After that, after 2 weeks, I'm bleeding 7 days, 8 days, heavily. It disorganized all my system. Are you seeing that? Now, I am a woman who is married to a believer. Who doesn't want to know about family planning, simanyabichi. Even me, I myself, I fear to get issues in my reproductive system. I have moved far up to even checking my hormonal profile, whereby I think I thank God that I got my girl first, the last one. But still, me, I fear him, because the moment I will tamper with him, still I will get a child. It is also bringing issues. Of course, when I abstain from the man, those are issues of war in the house. He also says now a child will come. So help me on that. What should I do?
Okay, thank you for your concern and the question. Now, we are discussing with the balanced people, normal people, people who are out of the normal range like her. It becomes very challenging. Very, very challenging, and I can't promise you that for sure I have an answer for you, apart from abstinence, which will bring gender-based violence. You get it? So it's a tricky thing. Then another thing, I talked about the hours, but I did not complete that point. The hours are very important. So to be safer, though I have said that the danger day starts from day 9, this cycle follows its own hours. So to be safer, subtract 1 day here, add 1 day here. You get it? Because she may tell you, I started the other day, but she will not tell you the hour. So to be absolutely safer, if you're a balanced lady, don't say, doctor told us up to day 8 we are safe. I did on day 8, now these things are lying. Because science and God, we cannot understand them. God is the boss of the science, isn't it? So the only thing we try is try to be safer. They have said day 8 is safe, but my friend, be safe. Subtract 1 day, emergency day, isn't it? So meaning that stop at day 7. Then here, you add I would even prefer you go to day 17. Hey, you add something such that you are clear from danger. You don't want any chance of error. You get it? That will be the best. But now for her case, it's tricky. I can really, now the only thing I can advise you is, as a family, sit with your man down and find out what works out for you. Right now, I may not know what works out for you, because you can really see that for you, this one may be a tricky one for you. Very tricky one for you. So abstinence would be the best. The good thing is a believer, so because he's supposed to support a woman, he can really support and say, maybe let's do abstinence. That's what I can advise. I saw some hand, I don't remember.
Doctor, there is a question behind here. That which days, on those danger days, which ones can a person go in and get a girl or a boy?
Doctor, thank you very much to come and give us some knowledge here. Now, mine is that, which hormones does a man have to produce a baby boys or baby girls and a girl? Thank you.
So can I first ask?
Okay, for clarity, when I follow that calendar, and you said the sperms spend about 3 days alive, so maybe on the 8th day, the sperms have entered, and they're going to go into this other danger zone. How is that calculated?
Though 8 days still appears normal, isn't it? But sometimes it has been discovered that some ladies ovulate to release the egg on the 11th day. Some even on 10th day. People are very different, you get it? So it means 9, 10. If it's released on the 10th day, then the egg will meet the living sperm and fertilization will take place. You get it? So the reason we leave it at 8, though I tell you that at least subtract again because of the hours. You know, some they cannot tell you the hour when she first saw the thing and you start counting. So it's better to remove 1 day behind and add some 2 days in front. Even some they can remove 2 days behind. So let me first also answer the 2 questions in one. Now, there are factors that determine the sex of a child. There are like 5. I remember all the 5. Number 1 is genetics. We can't control genetics. There are some families, for them boys, girls. You cannot control that one. But we can try to play around with us. Let me go to the second factor. The feeding, isn't it? There are some foods that have been discovered to promote the sexes of a boy or girl. Let's look at where we come from. In the East, you go to class. Remember when you started in primary, there were more boys than girls, isn't it? We eat hardy foods, the carbohydrates foods. And that's why in most cases, when a man has just got married and life is hard, the chance of producing a baby boy are very high. But when he gets money, he starts producing girls. But not always. Of course, other factors come in, isn't it? Then when you come to Buganda here, where people are eating soft foods, matokes, macarons, for them producing a baby boy is that challenge again. For them producing a girl is again simpler for them. But other factors come in. The only thing is that on nutrition, some foods make it easier to produce a given sex. And that one, I will explain it better in another factor. Let's first go to number 3. The timing. The timing. Now, for women, you have these genes here. You have XX. For men, we have XY in our sperms. Now, Y is presumably empty. Some studies assume that it's empty, it's carrying nothing. But again, other studies have discovered that it's carrying some things, but in reality it's light, isn't it? When you have a light sphere, and with a heavy one, which one moves faster? The lighter one, isn't it? The lighter one moves faster. The good news about it is that Y dies faster. Though I would say that the sperms live for 3 days. For it doesn't reach the 30th day when it's dead. That's why people who are travelers, like a family the husband is a traveler, the chance of that man having girls is always high, because by the time maybe leaves the wife, she was not yet in ovulation, she goes, by the time she ovulates, the Y died long ago, it's only X, because when you get an X from the woman, this man, an X from a man, X, this a girl. Then a X from a woman and a Y from a man, this is a boy. And I've just announced that the Y dies faster, isn't it? So the timing, you can also time that, I think I'm tired of this, let me try for the boys. It is trial and error, not 1 month of doing the thing, of trying the experiment and works out. Keep on trying, isn't it? No, if you're tired of the girl and you want the boy, you can say no. Now, let's talk about this one. Let's assume this woman ovulates on day 14 and you're trying out for a boy. When should you do it? Then it's better to do it on day 14, isn't it? Such that when you pour them there is competition between Y and X. Y will outcompete the X because it's light, isn't it? It's what? It's light. Then you'll be following me very well. Then if you want a baby girl, then it's better you say, let me give this Y a chance to die, isn't it? Then you say, if she's ovulating on day 14, when should you last do it? You do some subtraction backwards, isn't it? But you trial and error. Number 4. Sex positions. Sex positions go with the length of the man. The other first diagram I drew, don't worry. But sometimes the men who are longer down, the chance of producing a baby boy are high unless you play around with the other factors to come in, isn't it? Then a man with a short thing, you deposit them behind like in a city square, then you make them to run from there. Now, first wait, when you deposit them in city square, it's like driving a car, a heavy car and a light car. A light car on a highway is also not stable, isn't it? Then what you should know from the other diagram that I drew about a woman like this, I don't remember, it doesn't look good, isn't it? Within the vagina of a woman, it looks like a forest if you look at it with a machine. The way you see a forest, the way you see it. So the other light one can easily get lost in the grasses, in the trees there. It dies there, it's killed there. What kills it? The white blood cells of a woman. They also kill them like foreign bodies. That's why for the ladies, if you monitor it, when you meet a man for the first time and sleep with him the first time, the next day you are sick because your body reads the sperms like they are foreign bodies. They are causing a disease to you. Until again you get used to man. That's why the honeymoon babies in most cases, they come out when people wed. This wedding, a holy one, whereby before wedding they had never messed before. Then they mess for the first time during the honeymoon. In most cases, that baby comes out because the body of a woman is not used to the man's sperms yet. There's a lot of science there. So when you put them in CDCU and competition, the light one gets lost along the way, gets trapped. Then the X heavy one can knock the trees. It goes and it proceeds with the journey. You understand? So this one, sex position can go with the size of the man. C3 here, you can use it to try to beat the genetic factor. C3 here, you can use it to try to beat the genetic factor. You understand? So you can also try your science, trial and error, but you need to, they work. Some people they have worked for them. They have worked for them. They have really worked for some people. Have I answered? Mama, have I answered you now? So this one here, sex position, maybe I've not explained. Just meaning any position that ensures a man ejaculates deeper. Get it? Deeper. So you increase chances of the Y outrunning the X and you produce a baby boy. Northern Uganda, Eastern Uganda, there are many boys there. You get it? I don't know about Sudan. I've never gone to Sudan. I don't know about Sudan people. But as you come down this side, the girls are more than the boys, for many reasons.
Is there a way, maybe signs or symptoms or anything you can know if you're maybe about to ovulate or when you're ovulating? Because if you have maybe irregular, to get to know from that.
Yeah, it's a good question. But it requires a woman to be very keen. When the body is releasing an egg, you can feel like something has pierced you here, but you may think you're sitting in the wrong way. It takes a few seconds, then the pain disappears. If you have been following your periods very well, you can actually track it as a lady. You are there doing your things. If you want to prove it, if you understand your cycle, then you say, hey, I expect ovulation today or tomorrow. You can sit there as a woman, you feel like something has, have you ever seen someone, you feel like something is pricking you? But in a few seconds.
Yeah, this one's now out of that. This one is personal. I'm a patient of diabetes, and it has never stabilized. And yet I'm on treatment and tablets. And in the same time, I have arthritis, and I have constant pain. And even I'm on that treatment also. And I'm told that of it is hormones, so what I don't know.
Okay, let's first start with the diabetes. To treat diabetes, it's a game. Ideally, the proper treatment for diabetes is a weekly game, a 7-day game. When I tell you today, take 1 times 1, I expect you to take that for 7 days, the metformin, right? I don't know your age, Mama. The age, your years. You're still young because 65 and above will change. So when I give you 1 times 1, ideally, properly, and the people have treated for diabetes and even others get fairly better or better. After 1 week, come back and we check. If it is still up, I change you to 1 times 2 for another week. After 1 week, again come back. I check. If it is still up, I take you to 2 times 2 for 1 week. When it refuses, I take you to 1 times 1 that metformin and I introduce the second tablet. Again, I start the game afresh. The other tablet, I start with a half. I don't know whether you have been given a small one or not yet. It's only these big ones here. 1 times 1. I'll also tell you about German later. So, but they're still the big ones, isn't it? Meaning that they have never taken the other one. So when we introduce the other one, we introduce with a half, then we play the game. If it refuses, we increase the other one to 1 tablet and still play again. As you are changing your lifestyle. So the only thing, to cut the story short, how I help the diabetics, and I give the same advice with the pressure, because I don't know your pressure, because those things are twins. They move together, diabetes and pressure. I tell you, check your weight. After checking your weight, I tell you, in 3 months, remove for me 3 kilograms from your body. Whatever you do to cut the weight is just excellent, because there are people who take the tablets, but they don't change the lifestyle. They don't get better. Then talking about the German drugs. In our treatment in the hospital, we are trained, when somebody comes with the Range Rover there, you can't use these medicines of 500 shillings. You will throw away. So when somebody comes with the Range Rover, you also shift the drugs. Because the truth is not that, okay, one time during COVID, some doctor talked on TV, what we call blanket diagnosis. Then people have talked about the gun, but it is our secret. We look at how you come. Then I decide, because the truth is, if you come with a Range Rover, the fuel from home up the hospital is 50,000. Then I give you medicines of 2,000. Can you take it? You will say, I don't know what I'm doing. But when I give you drugs that cost you 300,000, you will take it. And yet in reality, the other cheaper ones were effective. So when you come to the hospital, Mama, please forgive me, I'm not attacking you, but I'm just advising. When you get somebody who says, for me, I don't take India, I take only German, I take in Jordan, I take UK, what. You just know where they are. Even if they have not come with a Range Rover, but they are thinking in the other order, they will tell you, India doesn't work for me. And it works perfectly well. So, Mama, to help you, 1, anybody with the pressure or diabetes who is here, rule number 1, I tell you, buy your machine for checking sugar at home. 2, you have got my numbers here. The thing is, the proper treatment is a weekly target. We change drugs every week. It's 1 times 1 today for 1 week. Next one, we change accordingly, because when it's getting better, we start reducing it again. We don't stop immediately. You get a problem. So when at the end of the week we check, it's better, you say, okay, let me downgrade it. Okay, the reason I'm downgrading, reducing it, because I'm like, okay, her body is also waking up to take over, isn't it? Otherwise, don't take, like you met a doctor in January, they told you 1 times 2, then you take a whole year. I was told 1 times 2. Now, doctors also don't want stress. Like this stress of weekly, they get tired of you. But I've told you the proper way of treatment of diabetes, it is a weekly challenge. Every week we have to change. Go up, come down, go up. Sometimes you can come down, it becomes okay. But when you come down, it becomes okay. You keep on telling you, be on standby. Anytime it can come back. So keep on checking. Some people can even say for a whole year they are okay. But first you need to understand where the diabetes comes from. Etida, nisinyo. The pancreas. Now, that guy called the pancreas, it looks like one type of cell produces this medicine, this hormone that controls amount of sugar in our body, isn't it? Then the other one, it controls like during fasting. You're not eating. There is no sugar in the body. The body will be like, let me go to the store. How does it go to the store? By producing that glucagon, that chemical. That goes and breaks the fats back to the sugar to balance. You get it? Now, when you are, that's why I go back to the other thing I was talking about, that let's keep on checking our body weight. When you are fat, by the way, for information, I want to make an announcement here. If you know you are fat and you are still young, just know you're a very good candidate for diabetes at your old age. Just a good warning. One of them, when you have this, you're a candidate, but you can wake up in advance. Now, remember I said that the sukari, the glucose in the blood is converted to fats by insulin, isn't it? Which is produced by this. So you go and overeat. The body knows that there's some amount of sugar need in the blood. You go and overeat. This one is ever converting this to time reaches when the things get tired, and just like a hoe, when you buy a hoe, there's a time the hoe gets what? Used up, isn't it? When this one dies, the cell's producing. Will you have this? Then this one goes up in the blood, and you say you have diabetes. Get it? There are many reasons why the thing dies. One of them is being obese. When you are young, as you keep on growing, you're overusing them, they die. Other things also come in, like some viruses, like there is this virus that causes a tumor, mumps. Yes, a tumor, mumps, and many other viruses. Smoking, alcohol, taking a lot of salt, and also eating burnt food. You have cooked food, the food saucepan has got burnt, you go and enjoy to eat it. It also causes the things like that. So, now, when this one is dead, it's not producing insulin, we now have to introduce a drug that behaves like this. In the early stages, we use tablets, like the tablets Mama is talking about, the metformin, things like that. Get it? Then, of course, when it refuses, we can bring the backup, the glibenclamide as a backup to try. Now, time reaches when the body also says, hey, I'm tired of these drugs now, I'm used to them, they stop working. That's when we go to injections. If you get somebody saying, I have diabetes and I reach to injections, just know that one is about to go. That one, there is no coming back. The body got tired of the tablets, that one is about to go. I'm not threatening people. So, Mama, to avoid going here, when you're here, like you are still on tablets, thank God you are not even, you don't have number 2 yet. Follow my rule. I cannot sit down in the hospital and you don't do this. I just tell you, go there, check your weight. After, let's say you are 93 kilograms, isn't it? We also don't want you to lose weight very fast. You will become sick again, you die. So I tell you, in 3 months, chop for me 3 kilograms. You may even chop 2. Because whatever you do to chop weight is only good things in controlling diabetes. You understand? That's what we do. But in diabetes, like, people make mistake that it is only, when somebody is diabetic, the blood sugar is only up. My friend, it swings. It can be up right now from nowhere. It comes down by the time you realize you're shaking and can even die. That's why I want the machine to be with you. Those machines are not expensive. When you go to the pharmacy, it's around 80-something thousand. If you have it, then you're the best. Keep on monitoring your body. And when you monitor the body, you live long and better. But Mama, when I see you, we don't judge, but you tell the truth. You're not doing anything to your weight. I don't know your weight before, but still I see you have unhealthy weight. So go and do that, and you'll be okay. Check your weight, then you cut it. Whatever you do to cut it, because I can't list here that do this, no, just go and cut the weight. And you will see you'll be good. Because I don't want you to reach to injections. Injections, for us, you know what happens when you reach there. Okay? Also, I imagine you're from the village. Oh, you're from here. If you're in the village, I will tell you, avoid wounds. The wound, the whole body is sweet now. And especially the wounds below the knee. They are stubborn. That's why you see people with diabetes, they cut off the leg. You get a wound. First of all, a person with diabetes, that wound looks like the boiled potato. It's not like ours, the normal red one, isn't it? It's sweet, and the bacteria loves sweet things. That's why they grow, they become stubborn. That the wound can become a cancer in 2 days. You get it? So we tell you to wear when you're engaged in some activity, wear long socks. We don't want wounds below the other side that are stubborn to treat. Wear long socks, those heavy ones, and a gumboot, and you'll be good. But especially, mama, check your weight and reduce your weight, isn't it? And then, too, like I've told you, I don't know where your doctor is, but I've told even it's written in all books, only that I've told you don't want stress. It is a weekly challenge. You're taking 1 times 1 for this week, check. If it is constant, you can say, let me continue. If it's constant without reducing, it means the drugs are doing their part, but you, with your lifestyle, you're not doing much. And the simple thing is, we tell everybody, in a day, you walk for 30 minutes every day. But not walking like this. The walking, if you have not sweated, you have not done anything. The walking that makes you to sweat is the exercise, because you are burning. Sweat means you have burnt these guys. You're reducing their store, isn't it? You are reducing them because you don't want them to accumulate. This one's also accumulating, and you're also reducing this one. So 30 minutes a day, 5 times a week. It's not that every day. The body also needs some rest. Can say, let me walk 1, 2, the other day, let me rest, like that. Walk, okay? And you'll be good. But most especially, you say the pressure is good. Okay. It is only when also the sugar is high. The reason is you have ever mixed the sugar in water. The sugar makes water thicker, isn't it? So when the sugar level goes up in the blood gets more thicker. So even the way it's moving inside the musua, the blood vessel, it is sluggish. So the heart has to use a lot of force. That's why when the pressure goes up, even the sugar is up at that moment. You understand? Those two things are twins, the sugar and the diabetes. One comes before the other. If you don't manage it very well, the other one will come automatically. And now, the hardest people that we hate in the hospital, somebody with the diabetes, together with the pressure, and with the ulcers. Because in the diabetes, sometimes fasting is good. Ulcers, you can't fast. Pressure, things like that. So those ones, we just say, if you hear that they have shifted to another hospital, you become happy. You'll be like, they have shifted the stress. But people who have the 3, it is hard. So now, at least now, have you seen the relationship between the sugar level and the pressure? The pressure makes the sugar thick. The sugar makes the blood thick. Then the heart starts using much what? Much force, and the pressure goes up. Mama, check the weight. And all of us here, including my pastor, sometimes I get pastor with some lubuto. And the problem, now this is an announcement to all Africans. You are the ones killing us. When somebody is gaining weight, say, hey, he has got money. You are killing that person. When he loses weight, I think life is hard. They even start forging stories. I think even at work, life is very hard. Now, when you are fat, they don't know, you don't that taking you to the grave, but they just say, hey, man, your life is good. That's bad. Look at the white people. Obamas have a lot of money. Let me first give you, I like reading a lot. I read about American presidents. The only president that disturbed Americans is Bush. We all know Bush, some of us. Americans, the president, you don't decide what to eat and how much. They decide for you. Bush refused. He was liking this, they call them McDonald's, this thing of ngano. That's why he's always in and out of the hospital with heart surgeries. I talked about Cowboy Kimbo. If you're a big person, you have a fat body, also try to avoid ngano, wheat products. And soda, they make controlling of weight very hard. They make control of the weight what? Very hard. So that's why we go to cooked food. Let's eat cooked food. The bank is not in the stomach, that government stomach. My friend, there's no money here. This is death. So let's be mindful of what we eat. And let's stop killing other people. When somebody is working on his weight, I think life has become hard. No. And us now, the rest who have had the information, when you're chopping weight, close your ears from the others. When you see, I think that one is sick. That person used to be fat. HIV is very bad. They bring other things. That's bad. That's bad, isn't it? So that's the thing. So, and there are 2 diseases that everybody should fear. When you are younger, there are 2 diseases waiting for you. If you are in 60 years without pressure and diabetes, you are too lucky God loves you. Otherwise, to reach 60 years without one of those 2 guys, oh, it is very hard. Why? Because when you are still young, we misuse our lives. Grow fat, do anything we want, things like that, you reach there. So when you are still younger, let's be mindful. We change our kitchen. The kitchen is the first hospital. That's why I tell you, treat the kitchen, manage the weight. Any question, Pastor? But I like this. I wish it could be a once a month thing or twice a month thing. I also love it. Why? Because I'm happy 1 or 2 people are going to go home changed. Not everybody will go home changed. There are people, even the Bible says you put them in the water. I don't know whether I'm wrong. But the 1 or 2 goes home changed. That's what, because ideally for us in our training, they tell us the first medicine is health education, teaching people. But my friend, I told you, when you're in the hospital, you teach somebody, becomes wise, you lose a customer. You only teach the ones you love, isn't it? Because now like that, only that for treating diabetes and sugar and pressure, the money is not there, so you don't want them. They disturb you, they don't bring money.
Doctor, mine are only 2. One, I'm requesting to meet you physically, one-on-one. The second one is, it is disturbing some few of us here. We have a problem with the cesarean section. I'm requesting you either to clarify to the few elements who are here, who are undergoing cesarean section in birth, how long they are to take so that they give the next baby, and how many times that person is going to quote, yeah. It is disturbing us silently, but now we are sometimes putting it spiritually, that God is there will help us. So, help us on that part. The other one, I'll meet you alone.
So, we all know taxis. I was looking for... We all know taxis. So, in a taxi, there is a passenger. A passenger is, in this case, a baby. So the reason for accident, the accident can come on the way due to a problem with the taxi or the passenger misbehaving. That's why some drivers say, I don't want to sit next to women, isn't it? Let's start with the passenger, that's the baby. The baby may have a wrong lie. The baby, instead of lying, towards delivery, let's assume this cup of this thing is the head. Towards delivery, the baby's head must face down and come out, isn't it? Now, for some reason, one, when your husband, first of all, when you come for antenatal to the hospital, we want you to come with your husband. Because when you're a short woman and the husband is very tall, the passenger is also going to be very tall. And your womb, the nirvana is small. So when the baby is starting to grow, it starts with the head up. Then it has to turn. So the passenger is very tall. He may turn and doesn't complete the turn. You get it? Then he remains. That's why I say the baby is not lying very well. So now that one cannot come out. We have to cut you. That's why we tell you, come to the hospital with your husband. Such that we can book, we can plan. We don't say that separate, no? But we know that this is a risky mother. We even put there some codes on your book you can never understand. Such that whichever doctor is handling you, because you can do antenatal here, you go and deliver in another hospital. But the other doctor will just say, where is the book? You will see there all the warnings. We are warning whoever is going to handle you. That's one. Number two, the passenger may have a bigger head, which is not proportional with the hole where the baby comes out, isn't it? That's why sometimes people make jokes that when you're going to marry a man, first look at the shape of his head. You have heard of those statements, isn't it? Because when I have a big head, even my babies are God giver, they are going to be big, isn't it? That's about the passenger. Number three, when you look at this diagram of mine, though the other one was better than this one, but you'll understand this one, isn't it? Sometimes this umbilical cord can attach here to what, or it can cover the whole of this. And now remember the passenger is here. He can't come out, isn't it? Because to come out, he has to first break this, then come out. And if he breaks this one, he first remains there for some minutes, he will die. So that's why we do the scan. So we want to see the position of the attachment of the umbilical cord, isn't it? But this one happens mostly in mothers who have produced many babies. That's why when you come to the hospital, we ask you, how many babies have you delivered before? Because every place where the baby attaches, that place after delivery remains a scar. The other baby cannot come to the scar. It has to come and look for the fresh parts. So when you have many babies, the scars are up because most cases they start from up. All up is scars. It has to look for where there is no scar. It may come down near the exit, isn't it? Then, of course, for the twins, these days, if you're a doctor and a lady has a twins and you give her to deliver normally and she dies, you'll understand. Because twins can be like this. The first one may come, the legs first. The second one, then they lock from here. Now you can't cut this bone. So twin pregnancy, the safest these days is pull them out normal, isn't it? And then that's about the passenger and other things I've forgotten. Let's talk about the vehicle. And that's the language used in the hospital. The vehicle is the woman. A woman with a big attitude, but that one just, you can never hear any problem. A woman with a big attitude, but that one just, you can never hear any problem. She just goes to the hospital, comes back with a baby. Even here is large. You get it? So and that's why when you go to the hospital, the doctor's table is always direct the door. We have to see you once like this. We don't come looking at you. Of course, other things we shall complete later looking at you. But I think if a baby has a short feet, then you're bragging, my wife has short feet. My friend, there's a problem. Even here is now, isn't it? Then too, there are ladies with the flat feet. You know, flat feet, there is a depression here for everybody. There are women, when they are walking, it's flat, isn't it? The ear is also blocked like that, isn't it? Number 3, the women with the last toe doesn't touch down. You know, those women, it is up, He's also warning you that there is a problem where? At the exit, at the gate. So we look at all that. Then another one, on top of the height of the man, we also look at what gives the woman what the women call the cabina, the buttocks, isn't it, coming out? There are those bones, we call them the coccyx. If the bones are inside, of course, the woman looks flatter. So when the bones are entering, they are blocking the gate. We also cut you. Then there's another one. Which one? Power. A car when the engine has no power, it cannot move, isn't it? We keep on checking your pressure and we see you're clearly a weak woman. No, we don't give you a chance. We cut you. You get it? Then there are other emergencies. The passenger may be okay, even this one's attaching very well, but for whichever reason, the cord is, we call it a cord tie. The thing is tying around the neck. That one you don't give chances. We cut the woman, isn't it? Then sometimes this tube here, the umbilical cord, can come out fast, which is also, remember, the baby, before it comes out, it keeps on receiving food and oxygen through that thing. When it comes fast, it gets squeezed. The baby can easily die. That's why that one, you need to pull out the baby in maximum of 3 minutes. Very fast. You hear nurses running in the hospital. Doctor, cord prolapse, my friend. There, the baby needs to be out because beyond 5 minutes, the baby will be dead. You get it? Then also, there's just getting tired. You are the lazy one. You're pregnant. You don't want to make the body strong. You are the lazy one, sleeping all the time. Even the baby will be lazy inside. Then you produce a blue baby. Now that blue baby, wait and see if that, okay, a baby who never cried, because you may not know a blue baby. A baby who never cried, wait and see the performance in the class. It is okay, isn't it? Laziness, and we love it so much. What, have I forgotten anything about the passenger again? Then also there are other things that you may see. The woman has everything normal, but it has happened like when a girl suffered from malnutrition when she was younger. You know, a child was young and has suffered from malnutrition. Some things don't develop very well, especially the gates here. So she can also be cut. Then also there are women who have infections, like we have what we call HPV. The Bagana call it, is it a chinanasi? The Bagana call it chinanasi. I don't know, I've never seen it in Teso. I don't know it in Teso because I've never worked in any hospital in Teso. You can get around here. We don't want that baby because when the baby is coming out, the baby will get that infection from the vaginal canal. So when we are checking you, we see you with the HPV signs. When the baby is safe, we cut you. So there are many reasons why we cut women. Then, of course, these days, there's what we call elective. A woman just says, I don't feel pain. She books it. Then also there is the last one, the worst one. These days, doctors make money. They know no more delivery, no money. So they forge a reason, and they'll write that reason on your form. Because remember, everything we have to account in the hospital. They say there was because now there will be no evidence. There was a cord prolapse. And then they cut you because they want money. So there are many reasons. Others are genuine, others are not genuine. The genuine ones happen in government hospital. The ones for money happen in the private. They want money. That's why when you go to private, almost because remember, I worked in private a lot. It is stressing. At the end of the day, your shift, they're asking you, how much money have you made today? There is a target. Target, they tell you today, Oluka, try your best. Let's make 3 million. You see how it can torture you. You are doing that. Somebody comes, the day you do 3 million, say, hey, look at they have worked. Because the bosses are not medics. They put their machines. I think that's why for me I tell people at home, when you fall sick, the government doesn't have drugs, but go to government and go and buy the drugs. I'm not discouraging the private because there are people who are in private doing the right things. Otherwise, it's now business, the way you see in the churches. You get it? Some churches are genuine, others are for money making. So you have understood them, isn't it? Then, the other part of the question, how many times we cut? How many children? One, it depends on the first reason, the first place why you were cut. If you were cut because of the cord prolapse, when other things are okay, you can always produce. But if you were cut because of the problems with the vehicle, short feet, what things, this is what we do. This is your stomach, isn't it? The first scar, this is the kundi, the umbilical cord, isn't it? The first scar, we cut there. The second scar, we cut there. Wherever we cut, we don't repeat because it becomes weak. It can separate, isn't it? Sometimes it can again come down here, but remember there is a problem here, isn't it? That's why it is too healthy to have two if the problem is with you. Remember, we advise we don't make a decision. The woman can come by the time you realize, I told you, but again you're here pregnant. You leave her. But now you're increasing your chances of dying. You understand? And in the hospital accounting for, because every death you must account. Why? Accounting is for someone who was a risk mother. It is simple. Very simple. She died. This was a risk mother. Things like that. Things like that. So, then, but the important thing, remember, every cut is a scar. And the scar becomes weak. So give yourself 2 years before pregnancy again, so that the scar can heal very well. But how many people really listen to it? In 1.5 years, she's back with the pregnancy. You cane her. We don't have sticks in the hospital. The only thing is just say, let me handle her as a risk mother now. Either she will die or she will survive, whatever it is. If she survives, thank God. If she dies, she was a risk mother. So we need a lot of information about this. But if it was a passenger, because the first one may be Caesar for issues of the passenger, the next passenger may be behaving well. You can now produce the rest normal. That's why some people say, for me the first was Caesar, but the other ones were all good, meaning that the passenger was a problem. But the other one, all of them, look at yourself first. Look at yourself. Then also, even premature issues, infections, you can have infections attacking the passenger and the mother, okay? Infections like there are some health conditions that may not allow a baby to cross 7 months. We have to pick it out. That's why we talk to you these days. I think you realize we want you to come to the hospital 8 times during antenatal. Some of you want to come, for me, my mother used to go when she was 6 months. That's very bad. Things change because science is getting better every time. We do research. So in fact, for the Bazungus, they're even better. They come to us, doctor, we are planning to have a baby. What do we do? Those are good people. But in Africa, every pregnancy is accident. Yes, they don't plan at all. If there is money, they just accept. But it's an accident, isn't it? So otherwise, that's why some of us watch TVs. How many Bazungus have dimples? You see them, isn't it? But in Africa, we have them, and these gaps between the teeth. Okay, there are abnormalities that a child is born with. Some, we call them beautiful abnormalities. But for us medics, the abnormalities, you are born with a gap here, we call it a chilo. Is it a chilo? This atoid. To a medic, that's not good news. For you, who's not a medic, it's good news. Yes. Then these dimples here, you are lame because these muscles here are round. If the muscle is lame, then when you're smiling here, then you say, I'm beautiful. That you don't listen to that. So, but all the things we prevent them during antenatal. Especially, I want to announce this because it's not bad. There is a small medicine which is too cheap. We call folic acid. That medicine is magic. And we avoid all those mistakes in the first 3 months of pregnancy. We avoid all those mistakes there. Now, the only thing is people appear about this child born Ichilo. Is it Ichilo? This one with the cut. Because when the deficiency of folic acid is too much, can make left lip or left palate, or baby with a hole up there, can be this thing here. How do you call it? Aruk. It can be this one, can be this one. Now, this one, there are two types. There is one lady called beauty. The dimples here. My friend, if a medic you are not safe with it, that's a problem. You know, these dimples I mean here, there are two. Ladies call them beauty. Wait when you get older. That's when you suffer with the pain. For us, it's not a problem. Then when the problem is bigger, you get this one. You have seen this one, the bifida. So folic acid, don't ignore it. Take it before you conceive. Have healthy babies. And the passenger becomes what? You also seen babies born with bigger heads. And the good thing we come from the east. You know, there is a cure hospital in Mbale where they treat those ones. Because in the whole Uganda, it's a very expensive treatment, so it's funded by the Bazungus. Those ones with the big heads, the hydrocephalus, things like that. So, the passenger can be issues. The vehicle can be issues. So you need to, I don't know, but I'm not now encouraging a short ladies go and marry short men. There we don't cause confusion in the community. But if you're a lady, we consider centimeters. If you're a lady, because a risky mother starts from 150 centimeters and below, you're at risk. These ladies who are very short, they are at risk. Unless the husband is also short, now the passenger will be appropriate, isn't it? But you're a lady, you're short like this, you also want a Sudanese man who's tall like this, the passenger will be tall, turning will be a problem, isn't it? They will cut you. The legs you're bragging there for me, baby shoes I share with my daughter, they will cut you. And many other things, isn't it? I think you have seen women with a big attitude, but those ones you don't hear them unless another issue comes in. Otherwise, those ones they go to the hospital in the evening, in the morning they have come back with the baby. They are okay, isn't it? But for you, you are there in the hospital a whole week, and you are calling Pastor, pray for me. Pastor, the other one, they are not praying for her. She's okay, isn't it? Yeah, so things are like that. And for us who are busy working, we don't have time to explain. Because if we tell the man will run out, isn't it? I think you see us in the hospital, we are busy, isn't it? We are busy. Yes, any other question?
I wanted to know, for me I have 2 scars. Do I have chances of giving birth normal also? 2 scars already. For me was the position of the baby. The firstborn was seated. Then the secondborn was across.
Passengers are the ones who are misbehaving. Also, talking about passengers, before I complete, talking about the passengers, we tell you to space children by 2 years, isn't it? Because when you are pregnant, the uterus is enlarging and it remains sagging, loose. So 2 years, at least we expect that it has gone back to the other normal thing, such that when the passenger is turning, we don't want the passenger again to swing. Is turning, is rotating, things like that. That one, when you give birth before 2 years, the passenger can start swinging. By the time of birth, is not facing downwards. So spacing is also good, okay? Then that's one, them failing to turn properly, there are many reasons. That's why you needed to be investigated. Maybe the timing, whether the spacing was good, things like that. Then again, talking of spacing, you produce one today, then it's, I've also had women making that, but we don't comment. For me, the next one is after 5 years from now. When you, 5 years, that's a big gap. Your body has gone back to almost a virgin state. Your muscles have become big, hard. Remember, now you are older. Your muscles are less elastic, and the joints, isn't it? The joints of the bones here. My friend, you are a risky baby. These ones are not expanding to come out. We shall cut you. They are hard. It's not that we intend. They cannot expand for the baby to come out, isn't it? I want to deliver next one 5 years from now. We keep quiet. It is okay. So everything is, you need to have a balanced one, isn't it? So the spacing, then women who have given birth more than 6 babies, now the uterus is sagging, it's loose. Those ones, the baby will be swinging, they cannot turn very well, isn't it? Then also there are women, we have also seen women who are, when a woman is turning, here is big, of course, then of course behind are heavy, isn't it? Now, what makes a woman here to be big is the uterus. It's bulky. And sometimes when you get pregnant, you feel like the pregnancy this side. The women, 3 months, you can clearly see it, isn't it? The baby doesn't do a U-turn. Remember, the passage is in the middle. Your pregnancy is outside here. Can a baby move like this to turn? No. So even a sagging abdomen, they will cut you. But the women, 6 months, you don't even know she's pregnant. She will deliver. Then the women also with a pelvis, like for a man. This bone here is called a pelvis. For a man, the man's pelvis is like a heart. You remember how we used to draw the heart in primary, in those love letters? That's a normal male pelvis. For a woman, it's not supposed to be like that. It is, so the women who, when a woman is walking, you follow her from behind, you see like it's a man walking. She has what we call the male pelvis. And that one also, of course, now that one's the vehicle. Problem with the vehicle, isn't it? So there's a lot. So the best thing is, let's learn in a fun way, in a hard way, preconception care. Let's go to the hospital. I am planning to have a baby with my husband, and you'll have the baby. Then in case you've gotten pregnant before doing that, can you have 8 antenatals? Especially the first 4 are very important, because that's why we try to avoid these abnormalities. Then the last ones also. So we need to have them. Let's not dodge them that my mother used to go at 6, let me go at, you see, God is so good. God loves the ignorant, saves them. That's why you see people who were not educated long ago, they were saved from many of the things we're suffering from right now, isn't it? Now for us, with available information, we have internet and the rest, we are the ones suffering. You see, don't compare yourself with the other one. So and so, how about, my friend, it's not the same. We are not the same, isn't it? So you are you. The other one is the other one. Any other question? Which one again? I forgot which part of the question. This one here, the upper one, then there's this one. Then there is, sometimes we start with this like this. Okay, in this case, if the passenger was a problem, we count how many times, because the doctor has choice. The doctor can start with this or like this. Okay, if the cut was once and the passenger was with a problem, you still have chances ahead. You get it? But if we have cut, let's say I started with this, and the next one is this. Then the last one, remember the last one is really trial. Because you may see the skin as healed, but the uterus can easily divide and separate inside. It's weak, isn't it? Don't say, I think my skin has hardened now. No, how about inside? So, in fact, the last scar out of the three, the thing is count three. Out of that was just an emergency. But like I've told you, if you have the first cut and the problem was the passenger, you are not yet in a danger zone. Now the thing is that you learn to go for antenatals earlier. Have many scans as possible. The scans, we can't look at your stomach and see the passenger, but the scan gives us a picture, isn't it? That's why you realize these days, do you realize the scans are increasing? Because we want to monitor the passenger. But some of you, these people want money. They're saying, I even did a scan last week. Please, if they've told you to go and do a scan, still do it. We cannot see inside. It's the machine to help us see inside, isn't it? Because these days, World Health Organizations actually, the target is to reduce, in any country, want to reduce maternal death of women during delivery. Want to reduce, that's why these days they even tell you go for an endo 8 times. Then you say 8 times doing what? We are tired. No, we want to reduce. We also don't want women to die. They are our mothers, our sisters, our aunties. We don't, so follow, don't argue. The way you don't argue with the God, also don't argue with the science, isn't it? If they say do this, you also do that. You can be in the village, move with your book. If you have been doing an endo in Kampala, go nearby and say, hey, it's my time. They will write it there, because when you come there, we record. You get it? So want women healthy, want a healthy church, want people who are in a church to thank God, isn't it? When you're in a church, God, thank you so much. Even I'm sure, I don't know about God, but I'm sure even God wants people who come to church one Sunday without complaining, but they're only praising Him. I'm sure He will also be a happy God, isn't it? But everywhere you go, every Sunday, people are crying, I don't know about God, I'm not God. But I don't think it is a good thing. That's why God brings knowledge in. God gave him wisdom. Let's have some of these lectures. Even if it's just one thing you have learned today, it will change your life, isn't it? Things like that. And another thing is the myth in this false says we have in the cultures. Those are things that we try our best in the hospitals to fight. There are many myths, a lot. Very, very myths. If you rotate around a pregnant woman, whatever it is, those are false things there. I did that when I was in senior one. Senior one was 12 years, and my cousin's wife was pregnant. I was just at home with her. I rotated. My judge shouted, I ran just around. Hey, the baby was born resembling me. In fact, I was in boarding, and I had never even seen the woman before. If she got pregnant when I was at home, people would say, in fact, the whole clan says, if you're around those days, we would say the baby is yours. But it's common sense. Me and the man, we are cousins. Our fathers are brothers, meaning that we share the same gene, isn't it? So that thing of baby with what is the wire? The genes are the ones working, isn't it? There is no wire connecting you and the woman. So those myths, we dispel them and we move on. Are we okay? Let's have good life, drink enough water, have enough rest, pillows off. I did not talk about pillows. Pillows are not healthy unless you have issues with the pressure. Otherwise, pillows off. If you're a person and you snore, I know that's one common thing. There is no more snoring, but the resistance of every day, chance of you getting a stroke are high in your life. When you look here, when you touch here, there is a blood vessel moving like this and so blood has oil, fats. So you're churning them. So snoring is a bad thing. But one of the reasons people snoring can be one sign that you have excess body weight. 2, your sleeping position is not normal. When you remove the pillow, and the person becomes okay. But there are people even without a pillow. Look at the big people at home when they are fat. Like a generator. They are snoring, isn't it? There are many things that disturb people in the community, but they lack information. Nobody tells them. Like when you talk of the pillow thing. Then noise things. Noise, by the way. Noise is one of the things that causes the sickness. That's why I'm happy these days. Most churches When a church is young, they have disorganized machines. When a church grows, they refine the machines. Even the sound systems in the church, when it's too noisy, it causes stress in you. And stress does a lot of things in the body. So that's why these modern churches, oh, you go there, like today when I came, oh God, the music was nice, refined. I don't know, I was not here last Sunday. I don't know, even on Sunday, the music. So the music guys, please make sure that we should have very refined sound on Sundays, isn't it? The choir team should be refined. We should have, because for you who are not trained, you think sickness caused by bacteria or what, but even too much light can cause sickness. Bright light is, I'm happy even what I've done here, that's good. And then, but of course when it becomes too dark, it can make you sleep. Then uncoordinated noise from the system there can make people sick along the way. Then I'll come to my pastors. I have stood here for a long time, but I can assure you my back is paining. I see there is a disease that attacks pastors, teachers, soldiers, overstanding. In fact, today when I was coming, I was like, I love my pastor. I don't know. Pastor should modify preaching and sitting on overstanding. They suffer from hemorrhoids, but they don't know. The things that come from behind the anus. So my pastors also, yes. Then I was talking to Andrew one time. You know, the way I love this church, even when we were at home, we discuss about the church. Me and Andrew. I'm like, hey, Andrew, our pastors are young. What do we do? So it was like, then he tells me an example. For me, when I'm preaching, I don't know whether he has ever preached here. I don't. So the team there, as a teacher, pastor, I don't think I've been struggling here shouting. When you shout, put more force here. The force pushes the blood down there. Those things that come out, those are blood vessels. They get full with the. So the preaching, of course, there is time when you get fired, the Holy Spirit you can't control, but let's be mindful. The team there should be controlling your loudness. Some of you reduce the volume that then the pastor has to struggle. So we also need to save our pastors, because I don't want to, I'm sure nobody wants our pastor dead, isn't it? Because who remembers, sorry to mention about his name, but I can use it as an example. General Biraro. He was one time, if you know what killed him, remember he was a soldier and a pastor. So two things increased the reason we got what he got to die. Of course, he died of cancer of the rectum. It comes from down going up. So teachers, soldiers, okay, people who overstand. The way we receive those orphans who stand on their way, the way we receive them in the hospital, oh God. So let's save our pastors. So pastor, they should, I don't know, we should think about it along the way. Time should reach when you should have a long table there, and the preaching sometimes can happen when you're oversitting and overstanding. They're all bad. To imagine that only standing, oversitting, overstanding, obesity, chronic cough. You know when you cough, you feel how you push the pressure down, isn't it? Diarrhea, and this thing, this ones who go and read a newspaper in the toilet. Meaning that you don't stay a lot, you don't spend a lot of minutes in the toilet. When you're squatting, you put there a lot of pressure. And so one thing again, what's increasing in the community, you know, those hemorrhoids there. And people, because they're rare, this is when they keep quiet, they don't talk about it, but they are there stressed. What's this? You see them, they can't sit straight, isn't it? Because of the pain. The thing is very painful, by the way. It's very, very painful. So, but in case, then another thing, listen to our bodies. Listen to your body. Everybody has a body. When you see any change, go to the hospital and they explain to you. Because when you sit home, by the time you come there, it's too late. So listen to our bodies. So, Pastor, the music team should be well refined. We shall even enjoy music in church better. They should practice it better. The ones tuning your thing when you're preaching, they should make sure that they're loud even when you're not loud. You don't want our pastor using a lot of energy, shouting. You get it? We don't want that one. Any question? Yes.
I don't know. Started because I came late. If I repeat, I request forgiveness. Now, I wanted to confirm because I saw there is a lady I was renting her place. She was old, but I heard that she planted the eggs because she was not producing. Then they planted the eggs for twins. And he did. After that, they operated her to get children. Is it true? Second question. By the time my dad was sick, I was bathing him with the cold water. The moment I pour cold water in him, he can cry. So when I asked him what's the problem, he told me that by then he was used to bathe with the hot water. So the muscles now, I don't know, go to tired or what. Okay. Is it good to bathe with hot water all the time or not?
Let me first start with the last question. When somebody is sick, whenever you are sick, you see, God made everything perfectly. He did not only make humans perfect, including things that bring sicknesses. For example, let me give you an example, like a bacteria. It's also made by God. And it must be successful, like us. So when you get attacked by a disease, the disease also struggles to succeed. One, to block your mouth. That's why when you are sick, appetite goes off. The other one's also working hard, isn't it? That's why when you're sick, my friend, try as much as possible to eat. Otherwise, if you say, I don't have appetite, it's okay, the other one is succeeding. Number two, because they have poor appetite, therefore, remember they are using the reserves for the body, the fat reserves now for energy and whatever it is, isn't it? So bathing somebody with the cold water when he's sick is already, the body has to burn more glucose to generate energy. He's not even eating. So it's not good. So the best is to bathe not with hot but lukewarm water. The mothers know when you're going to bathe the baby, they test with the back of the hand, okay? Then, just about him. So the pain, he was used to the warm water, so it's just normal changes. Like, even you, when you try using warm water every day, but the day they give you cold water, I feel like the skin is paining. It's just that he was used to it. Then the other one for planting the eggs. When he said he came late, but there's no problem. I announced here that there are many reasons. Okay, I didn't even talk about all the reasons. There are many reasons a lady may fail to conceive. When you come to the hospital, there's what we call primary infertility, temporal one, that can be solved. So there are some drugs we give to correct that infertility for you to conceive, you get it? But some of those drugs, and the commonest drug, I'll not mention the name, you'll go and start buying. And even some women come to the hospital, I want to conceive twins. A bad doctor wants money, he will give you that medicine. The medicine works like this. It makes the body to produce multiple eggs at a go. And yet the woman, God made one egg here this month, one egg the other side, the other month, isn't it? So the medicine can make even this side produce two, even here one, whatever it is, one and one, and conceive twins. So looks like from your story, she stayed fast for long without conceiving, then she conceived. From I know the reason why she conceived the twins. Because most women we treat with that medicine, the side effect is that when they produce many babies, you even heard sometimes on TV, a woman producing 4 babies, 5, but they will never tell you that I have been in the hospital taking this medicine for infertility. So the good news is that she delivered. That's all we want, isn't it? That's okay. But that's the thing. They don't just plant the eggs. But of course, time can, but that one takes a lot of money. There are people who totally don't have eggs, you know. You can go there to fertility center, they implant there the eggs. Because sometimes where the eggs pass, when I drew my diagram, it may be blocked, so they can pick the eggs. And you can even order them if you have your money. Pick 2 eggs, then they implant them, they fertilize them outside, then implant. You can also go for that if you have your money, which is over 14 million, 14 to 25 and above. Things like that. Yes. Yes, give him the microphone. Yeah, but I am happy. Don't worry. Don't say he's getting tired. Because to me, the happiness I have, I feel I'm doing the right thing to the church members, isn't it? We need this knowledge. This knowledge helps us to live better. Yes.
Doctor.
Yes.
I've been sick for 6 months. This side of pelvic here, the west, it's one of my side here. It's paralyzing. So I don't know what have I got.
Hey, and you have been going to the hospital, they give you painkillers, right?
Yes, sir.
I know that it is one of the hardest diseases to treat. Where is your wallet? By the today, thank you. Have you seen where he has picked it from? From behind, isn't it? We call that this wallet syndrome. Putting things on the back pocket and sitting on them, there is a nerve that comes from here, goes like this applying. So you press it. That's the wallet syndrome. And the pain is sharp. You may even fail to bend. But they don't say that, God, this man is what these pastors who predict things. I just asked you because I knew that's wallet syndrome. Now, the medicine doesn't treat it. We give you medicine to control the pain. But the basic treatment is lower back exercise. Otherwise, you will take drugs until you say, let me try witchcraft. Lower back exercise. You have a smartphone, you go to that YouTube, lower back, then you start doing them. It's just like men. There are men who have these bags you use on one side. We discard those bags on in the hospital. I think this is him 7 years bent. He's a soldier, isn't it? So a good bag is this one, like the school bag, because it needs you to. So that's wallet syndrome. Wallet is your problem. When you keep it here, when you're going to sit, transfer it here. You get it? Otherwise, you'll. Then the best thing is don't use the wallet at all. I don't use a wallet. And the reason I don't use it, one time I lost all IDs. So I fear wallets now. But wallet syndrome is a serious one. Okay? Not only wallet, even sitting position. These chairs are good. Chairs that make you like this. But some of us these days, have bad sofas in our houses. These days people have money. You buy a sofa whereby when you reach there, you lie flat. You wait for your back as you get older. Otherwise, a good sofa is this one. A chair is for sitting, not for lying, isn't it? As I told you in the beginning, that sometime that a carpenter's mistake is a design. Now everybody is copying it. Everybody is buying those sofas in their house. It is okay. You get us in the hospital. Wallet. Okay? Okay. Any other question?
Thanks so much, Doctor.
Yes.
There's something that I wanted also to inquire. That was talked about. Because I happen to be one of the technical people in there.
Yes.
In the church.
Very good. I'm happy you had it.
And I appreciate the medical advice that you have given to us.
Yes.
But this is what I wanted you to put more light. Because in music, they advise us to use what they call vocals. Whereby you're supposed to coordinate 3 voicings. There's what they call a head voice, a chest voice, then a stomach voice. For you to bring a beautiful sound out. Whereby at times it doesn't need a loud microphone. Or its volume should be in the maximum point. And when you look at most of the pastors, not from here, they don't use that loud microphone. But they want to give their strength so that they have that beautiful output.
Okay.
And the praise and worship members. So how do we coordinate such to avoid problems?
You have spoken a lot of terms that I don't understand musically, but I want to make mine clear. Music, I learned music up to senior 2. Our teacher told us that music is organized sound. I'm not talking of the volume. There are some churches you go to whereby the person drumming, he's not connected with this thing here. So everything is just parallel. So we mind about chronology because what enters into the ear is what matters. You want organized sound to go to the ear. You understand? So meaning that the only thing is not I can't come and teach music. I totally have no idea about music. The only thing is we want organized sound. You get it? Because if the sound, you will get women complaining of menstruation issues here. What? You are not you. The problem is you. We are chasing Satan, but you are the one who is seated there, causing more problems. We want organized sound. Whatever you do to achieve organized sound, we want it, isn't it? Just make sure it's organized. The volume, because you can have disorganized sound when the volume is low, it's still disorganized. You can have disorganized sound when the volume is high, and yet you can have organized sound even when the volume is high, you still enjoy it. You get it? So my point is about being organized. Things should be organized. You get it? I don't know whether you have gotten my point. You got my point? Just make sure that I don't know how they tune it. Machine should be in balance. You get it? So that we can feel the taste of the music, not the disorganization. You have ever gone somewhere and you feel like, oh God, I don't even know how to play that machine, but that guy is playing like that. Just like, now on this, I want to mention about this one. It's not proper. The pastor is praying and you are there. You want to hear what the pastor is talking about. But you are there also disorganizing. You can make it low. In fact, it makes it sweet in the ear, isn't it? But you want to make your machine louder than the pastor. Now you are causing a disorganized sound. The pastor is saying, God, I want to thank you for today. But you're it's not clicking well. You get it? So you take the machines down and take it down so that we can hear the pastor, and the other ones just back up to make the message go sweet in the ears. You get it? The thing is, my point is this, not about sounds. You can, I also treat some worship members of some church. They come there, you test everything is okay, but this boy is sick. Then later you ask, what do you do? I am a choir member. You say, oh, yeah, the problem is here. So disorganized sound makes you sick. And when the brain is sick, the whole body is sick. You know it very well. That's why when the evil attacks the brain, the whole of you is sick. You want the brain to be okay. Let the sound be good. You get it? You want a church to be good. There's a time where we need loud music and we're all good, as long as it is organized. Meaning that you guys need to practice a lot how to manage your machines. You get it? You need to practice more skills. Give us some sweet sound. Okay. Any questions? I see Pastor's battery is down. His phone is even dying. Yes. I'm still okay. I'm very strong. As long as your questions are there. I don't want somebody to go home with the rest who are tired. You can be free to go, but this ones, I don't want to leave here without answering somebody's question. Okay, I've been told let it be the last question because we shall have more sessions in the future.
Yes, good evening, church. Praise God.
Amen.
Elder Teacher Julius.
Mm.
I have a question.
Yes.
First of all, I have a parent who has taken time crying of back pain. And it was like whenever he goes to sleep, he feels back pain seriously. And it has taken a long time. When he went to the hospital, he was advised that your sleeping position is not good. And they asked him the type of the mattress he's using, and he mentioned the type of the mattress, and they were like, that mattress is not good. Because whenever you go and sleep, there is a mattress whereby it's like you're in the boat.
Yes.
So they advised him that you need to change a mattress. But they didn't tell him the type of the mattress he's supposed to change.
Thank you. First, let me ask, is it your parent male or mom? Daddy or mommy?
It is the dad.
Oh, the dad. Now, it's like this. It's true. When you're sleeping, your body needs to be on a flat plane. Indeed, even you try it, even if you are still young. Sleeping, when some parts are entering, things like that, you will obviously get pain. In the hospital, they don't tell people to buy rose foam and whichever mattress. We only tell you, please buy a harder mattress, whereby when you're on a mattress, it's not entering. You get it? If the money is not there, a mat is cheaper. I'm sure, isn't it? Because you may go and get stressed and look for the hollow clan to collect money for the mattress. No. A mat can work, isn't it? That's it. It is just a simple logic. So you don't have to. This is entering mattresses indeed. After some time, you need to. Mattresses, when you buy them when they're still new, they are still hard, isn't it? As they get older, they lose their strength and they get softer. You need to change. If there is no money, if there is no crime, nobody will know that you are sleeping on a mat in your house. You get it? Yeah. So that's just. Oh, I should be the one to be the most happiest for this chance. Because what I know, I've saved a life or two. That's the most important thing for me. Two, in the hospital, we are also pastors. Not preaching the Bible, but doing God's work. I'm happy Pastor has allowed me to bring it today here, and some people have learned. And I'm sure, because when Pastor kept on calling me, I can trust me, I came here with stress. Every medic should not be caught anywhere discouraging hormonal. Not that we are both, but like at least some of you have even realized that there is a time when they are good, there is a time when they are bad, isn't it? Prolonged use is bad. There is a time when we give you the things to make you better, isn't it? Then for women, take it as not that I'm threatening your life, but time reaches in your life when producing saves your life than marriage. I'm not here to break the church that every child is from. In fact, Pastor, there are some people who speak stupid things on Facebook. Someday, yesterday, I saw it on my phone. I took a screenshot that Jesus was produced outside the wedlock. But I don't want to go deep there. It will disorganize the church. The thing is, women, get a man. If you're healthy, I know a man has always approached your life. You pray to God, get a man. You are in 30s and you're comfortable. It's not safe for you. You will make us very disturbed. Instead of having a program for building the church, we are praying for a sister who is having cancer. That's not good, okay? Let's get married when we still have. For the mothers, you have no business producing when you are above 35 years. Okay, if 35 years, but 40 years and above, what are you doing? Because you are a risky mother. When you die, accounting for you is very simple in the hospital. When you're 40 years and above as a mother, what are you doing producing? You should not be producing. We want you alive. Those children need you alive. We don't want, they say that child is for the other sister who passed on. It will bring stress to the children. I don't know whether I'll pass the message. Then, the Bible says, go and produce the world. For us in medical, we know any mother, 6 babies and above, you have entered danger zone. So I don't know what we shall talk about that one. We'll go and fill the world. But for us in the hospital, 6 babies and above, danger zone. When you die, simple to account. That's why when you come there, you know there's some G what or P6 plus something. It's simple to account for you. And yet we are supposed to advise you to have a. I'm sure the reason family planning came because everybody wants to have a manageable family. Let's have a manageable family, such that there is even peace and happiness in the family. Hey, imagine you have 10 children, you want a taxi going to the village. How? You even start others carry others, and it brings stress, and there will be no happiness in the family. Even worshiping God becomes a problem. So let's have manageable families. Okay, whichever method you use, let's have manageable families. Let's correct our feeding at home. These days we have a lot. Internet is everywhere, but we only go there for other things. You don't check the other things. There's a lot of information there. Now, however rich you are, unless you dry meat the village style, but what are you doing eating meat more than 3 times a week? What are you doing? Eating meat more than 3 times a week, unless the meat is the other dry one, which is because the other dry one you can eat it every day. You can. The fats have gone, isn't it? It's like fiber. But here you have money. Every supper, daddy, there is no sauce. Even when they prepare greens during lunch, it is still there in the saucepan. That there is no sauce for supper, because they want meat. Or if it is a fish, there is no problem. Let's reduce fried foods in our families. Let's have healthy families. Let's go boiling. You get it? Let's reduce the amount of sugar we take. I have no excuse for anybody having blue band in the house. and you're an adult eating Blue Band, I have no excuse for you. You're using Cowboy, I have no excuse for you. And what is that one? Cowboy and Kimbo, I have no excuse for you. But if you have had it today and you continue doing it, then it's your choosing. If you have been doing it before without knowing, I forgive you. Altogether, you have excess body weight, I have no excuse for you. I'm also, but I'm trying, and I came. Food is sweet. I came from 73, now I'm 69. According to my height, the maximum weight is 68. To chop that 1 kilogram is hard. I've tried. You can become happy today, eat chapati. The other day, you gained 1 kilo added. So but let's try our weight, okay? Let's try. Don't laugh at a brother who's like, there is a man in this church. Every time I come to this church, when I go back home, I tell Andrew, and I wish I was that man. I don't know his name. He's a tall man. He dances around here. Tall, wearing always a T-shirt. He dances. I was like, Andrew, that guy is fit and he can dance. He's not here today. I don't know his name, but you know him. You guys know him. When I look at that man, I say, that guy has a very nice body. I'm not saying that I'm a homosexual, but I'm just saying that he has a healthy body. Don't say, this man is a problem. No, the guy has a healthy body. Yes, but for us with Lubuto, then you admire as my friend. You don't know what you're admiring. You don't know. So that's the thing. And we see even when his church is jumping, he's doing exercise, and he can sweat. He jumps seriously. God should bless that. But he's still a young man. I don't know if there's Abraham, but he's a tall guy. I know him. He likes wearing a T-shirt. Hey, that guy is very healthy. If he's sick, something else, but that guy is healthy. And I tell you, every time I get him in church, I go back and say, Andrew, that guy is healthy. But for us, we want to be fat. We want to be this. Then our wives are praising you are taking care of Gundi. No, that's bad. Go and feed us well, women. Go and feed us well, okay? Feed us well. And let's have a joint effort towards health. Exercise together in the house is good. There is a man, he's a pastor in some church, but I also teach with him. I told you that I'm a teacher. He teaches some subject. But this man is very oily. When you see him, he's oily. I was like, and he has a body like his. I'm sorry to use him as example. He's even better than him. But the fact that I see him with oil, I was like, hey, my friend, you have a lot of oil in your blood. So he said, no, I do exercises with my family. I eat very well. Of course, I told you, we are trained not to trust the patient. I was like, but no, what you do, you first go to the hospital. And in the hospital, you check how much muscle, how much fats you have in the blood. They got him with the 332. But the maximum normal is 150. Isn't it more than twice? Remember, I only sent him, he was not sick. I was like, you get him, go to the hospital. You check your what? And he was like, but for sure. But I never explained to him why I sent him. He was not sick, he's not sick. But you're oily. Of course, when you're oily, it means there's a lot of oil in the body, isn't it? But of course, I'm not saying that you should have a dry skin. You should have a normal skin. So that's why sometimes being a medic is you go somewhere, you see sick people, but you keep quiet. You keep quiet. But you go home with the stress, but you'll be like, there is a problem here. You see, mother, I have no excuse for mothers. You are very advanced. You are 40 years and above. You are producing abnormal children, and you are here in church jumping, praising God. Praise God, I have a health. For us medics who have seen a child is abnormal. For you, what we see is not what you see. Women, what are you doing producing above 40 years? What? Even if you delayed producing. Of course, not every woman above 40 years produces abnormal child, but the chances of producing abnormal child are very high. You, Pastor, please, that one, I have no excuse for it. I totally have no excuse. We don't want abnormal children. They come with many complications, very many. I will not talk about other. So let's have healthy children, manageable children, family planning. I've given you the knowledge. You can now go and use it appropriately, okay? Appropriately. Let's be healthy, a healthy church. Our church should be the healthiest. A year should end when we have not lost anybody in the church. Isn't that wonderful? We should not have burials. Maybe unavoidable circumstances, maybe. let's say accident, but if the Holy Spirit is there, can guide us. Otherwise, if we could go a year without death, then we'll go to a target 1.5 years, 2 years, when people are healthy. That will be good. That will be good. Thank you, Pastor, and thank you, the church.
Thank you for coming. I hope people have even gone. I think we can just pray and we close the session for today. Other discussions can continue later. And I believe we shall have more sessions to talk about health. Wash us with the blood of Jesus. Wash us with the blood of Jesus. Wash us with the blood of Jesus. Almighty God, our God, Abba Father, Lord of Lords, we bless your name. Thank you for what you have gone through. Thank you for Dr. Oluka. Thank you for the persons that have been able to come here to get knowledge. We cover the knowledge with the blood of Jesus. It shall not be used by demons against us. Father, we have come to the end. We ask for your grace to bind us in one accord. Bless your servant, Dr. Oluka, so that he will continue admonishing your people in health, and that your people will have long life according to how you had purposed. King of glory, merciful God, accept us because you are gracious God. Powers of darkness, authorities that come to interfere, be bound. Accident, problems that follow us after here, be bound. Counterfeits, be destroyed by fire. Thank you, Jesus. In Jesus' name we pray. Thank you very much. God bless you all.